Okay. So we'll give it one more minute.
And I guess, Andrew, I'm curious if while we're kind of waiting for people to come in, we do have that introductory survey that we're hoping people could kind of complete. I see it's popped in the chat here. I know that a lot of you, this was also included in an email I sent out yesterday, but just while we're kind of waiting for people to settle on in, if you guys wouldn't mind taking that survey if you haven't already.
Yes, thank you. Okay, we'll give you all a minute or so to do that survey. And then we'll get started. See two people who have not connected to sound yet, so for you too. Not that you can hear that I told you that. Okay. All right. All right, we'll give everyone a chance to respond to the survey. Eric just put the link to that survey in the chat. And so this is just to make sure you have some information to go forward. So if you can't see the survey link in the chat, let us know and we'll drop it in there again. And then good morning, JR, as well as everyone else. All right, one more minute and then we'll kick everything off. All right, thanks for doing the survey, Linda. All right, about 30 more seconds. All right, we'll get started here, and then if you didn't have the chance to complete the survey, you'll have a chance later on as well. And so welcome, good morning everyone in Arizona, and we're excited to get to meet with you all today and talk about rural healthcare access and all of the cool stuff happening around the country and help you learn about it. So that way, you can take this information and run with it and do some cool stuff in the state. So before we dive in, we've been working with Todd from NACOG, Amy St. Peter, Arizona, and Didi Garcia and Hezekias from Maricopa Association of Governments. And we have been putting this summit together through what's called the National Center for Applied Transit Technology. And so we are a technical assistance center funded by the Federal Transit Administration. And we are here to help small transit agencies, so small urban, rural, and tribal agencies to understand the new technologies that are coming out for their systems. And we really focus this on the tools that are available to help you approach and resolve challenges that you have or accomplish goals that you have for improving your service to your community. So we don't push technology just because it's there, but we really focus on helping you achieve your goals and finding the right tools for doing that. And so do this through a variety of formats. And so which is at the bottom of the page, n-catt.org. You can see different resources that we have. They range from zero emission vehicles and green infrastructure to using data, visualizing data, and deciding on software. So especially scheduling and dispatch software is something that we have talked a lot about with a lot of people. And then we aim to show people some lessons learned from what's happened around the industry, the direction things are going, and then provide you with strategies and then help you walk through your own processes and understand what might work for you. And then we also provide technical assistance. And so this is one version of it with the summit. Another what that we do is called the Strategic Technology Technical Assistance Teams, because we love long acronyms. And those focus on one-on-one work with individual transit agencies to help you approach a technology challenge that you have. So it can be really specific, such as what specifications do we need for a fair payment system in an upcoming RFP, or more broad, such as we know we need to invest in technology, but we don't know where to go. We're here to help on both ends of that spectrum. And so we do that with our, it says strike teams here, but what we call our stats. And then also we provide these summits for different states. And so this is to help identify state level or at least regional level priorities and goals and projects for technology investment for different states. And so as we get through this, we'll talk more about what this summit will, the end product of this summit. So it's going to be really cool. When Todd and Amy reached out with this project idea, we were really excited to get to pursue it. And so we also provide workshops, both we have one on demand course, and then we also provide them virtually and in person on things like data management, digital tools for system redesigns, and how to use GIS, geographic information systems, for your planning efforts. So there are a lot of different avenues to engage with us. We definitely encourage you to do so. And I'm Andrew. I am the director of NCAT. And then also with us today is Eric, who will be facilitating a lot of the discussion later. So Eric, if you want to introduce yourself now.
Hi, everyone. My name is Eric. It's great to be here today. Look forward to hearing from you this afternoon as we unpack some of the things that we hear from our presenters this morning.
All right. And so for a brief overview of what we'll do today, some introductions and background, which we're currently working on. And then after that, we are going to dive into some case studies about innovative healthcare and transit projects that are happening around the country. So what we'll do for both parts of this is we'll have a block of presentations from some really cool people from around the country who are doing these projects that we hope they will inspire you to come up with your own project ideas in Arizona. So some have more technology baked into them than others do, but the goal is to give you ideas about how you can partner with healthcare, or how you can leverage some tech platforms to improve people's ability to get to healthcare services. And so we hope you take these projects and their ideas and build on them for what needs to be done in the state. So we'll do that. We'll take a lunch break, and then in the afternoon, Eric will lead a facilitated discussion. We'll give a little bit of information about funding at the state and the national level. Then we'll tell you about what the next parts of this extended summit will look like. And so, for a bit of a preview for these innovative programs that we're going to talk about, we have 5 presenters. We have folks from Flint, Michigan, from Oklahoma City, Oklahoma, from Prairie Hills Transit in Spearfish, South Dakota, and then also from Invita in Colorado Springs, and then also your own backyard in Arizona. So there's a lot of cool stuff in the country. This is just a small taste of what's happening, and so we're excited to get to share this with you. So with that, I'll hand it over to our friends in Arizona itself, and get away, Todd, Amy, Edie, and Hezekias.
Great. Thanks, Andrew. I guess one just kind of housekeeping item. I know we have a larger group with us today, but I see people are definitely utilizing the chat function. I think that's great, and we'll kind of be monitoring that. But I guess I would encourage people, and throughout the presentations as well, if they have any questions, to either throw them in the chat, or I do think that there's, I think that we're hoping for this to be kind of an open discussion. So feel free to pop in with any questions and unmute yourself. But I know that with a large group like this, it can get a little bit busy with some of if everyone's talking at once, but I think we'll do our best to manage that. But again, thank you everyone for coming. My name is Todd Morris, and I guess I kind of just want to jump right into the heart of it, which is this next slide here, which I think that this slide here and this map, I think is just a great visual in terms of why I'm here today, and why I think a lot of you guys are here today in terms of taking a look at healthcare access in Arizona. And so this map was developed as a part of an article in the New York Times back when COVID first started. This article was centered around, I think it was mainly wanting to speak about some of the challenges when COVID was really hitting some of our tribal nations hard, and the Navajo Nation. Kind of early in 2020, but I think that this image really speaks to what I think a lot of us see on a day-to-day basis in terms of long distance transportation challenges to healthcare appointments. And I think that can be kind of boiled down to general challenges with getting people access to healthcare. And so this map, I think that some of the way that the data is distributed is a little funky based on some of the census block groups on how that was allocated. But I do think that the chart to the right here that talks about how Arizona ranks in terms of the number of people that are living further than 30 minutes from the nearest hospital is pretty eye-opening to see that we're in the same category as the Floridas and the Californias in terms of total populations that's considered a longer distance from a healthcare from a hospital. And then taking a look at that graphic to the right, looking at older adults, I think that's even more eye-opening. Seeing that 106,000 people 65 and older live further than 30 minutes from a hospital. And so I think from the transportation side of things, we know that this is a challenge that we're all faced on a daily basis. And I think what we're hoping to do through this is, hey, this is a huge challenge to try to address. I think when I think about this kind of problem, I often think of the analogy of trying to bail out the ocean with a teaspoon, just in terms of the amount of different complexities of working with all the different jurisdictions and all the different partners that are associated with healthcare access. But I think that what we were really hoping to do is, hey, obviously this is a major issue in Arizona. How can we bring together sort of a large group from around the state to talk about what type of ideas do we have on how we could potentially look to start chipping away at this a little bit, and how we could utilize some of the expertise from around the nation to kind of form some potential working pilots on how we'd want to pursue and just try to, hopefully make things a little bit better and identify opportunities for success that could maybe be replicated and expanded throughout the state. And so this next slide, when we think about, I guess this is just kind of one example of the different types of ways that, and this is just kind of a back of the napkin, initial thought on what things could look like in terms of how we could try to address this is, we could look at telemedicine hubs in rural areas. So instead of, transportation providers traveling long distances into Phoenix for healthcare trips, is there ways for them to transport somebody just to a local telemedicine hub in a rural area that they're able to kind of utilize telemedicine? Is there a kind of a partnership that can be worked out there? Is there roles for medical clinics or mobile clinics, excuse me, to kind of bring care to some of these rural areas versus always working on bringing people into some of these kind of healthcare hubs? It's other areas around coordinated appointment scheduling. Again, when we're taking long distance trips, is there ways just to maximize that efficiency and try to group trips as much as we can? Is there other ways just in general that we could create better communication between our transportation providers and the healthcare providers? There's sponsorships or other types of partnerships we could look at. And so that's just kind of, I'm hoping to sort of create a test of just a taste of some of the potential options that are out there that we see this kind of technology summit. And I'll kind of talk about that here in the next slide about what this whole process is going to look like, that we're hoping to kick off today and hoping to kick off this morning with sort of injecting some examples from around the nation that hopefully we can kind of take and chew on and look to apply here in Arizona. So again, that last bullet there, we are really hoping this afternoon to have a lively discussion about things that we're seeing and things that maybe we'd want to try to take a swing at and try to work together to try to accomplish and put into action. So really looking forward to that discussion this afternoon and hearing from you all. But this next slide, kind of helps set the stage for, again, NACOG, and I'll talk about what NACOG is here in a moment, as well as Age-Friendly Arizona. We saw an opportunity here to reach out to the NCAT team that's going to be facilitating today's discussion to put on this technology summit, is what we're calling it. So this is really a part of this is in general kind of broken down into 3 distinct dates where we have our webinar that we're hoping to that we're going to be holding today. Kind of piggybacked on top of that webinar is next week I will be presenting along with Eric at the Arizona Transit Association conference in Mesa, and that presentation is really going to largely duplicate what we're talking about today. But what we're really hoping to do is at the end of today have some ideas about some leads, I guess, for some potential initiatives that we would like to invite potentially smaller groups to a in-person workshop in Phoenix on May 9th. And so we'll talk about a little bit more of the logistics around that towards the end of the meeting. We're hoping in that May 9th meeting is where we can really kind of dive in deeper to some of the concepts that we're going to hopefully introduce today. And then in June, we're going to hopefully look to facilitate sort of a mini kind of Shark Tank style presentation where we'll be able to bring in potential funders or people that are involved in healthcare access, people that we think that would be that would really be able to kind of shed some light on the opportunities and kind of help support these pilots through sort of a Shark Tank presentation where they'd be able to give feedback and help kind of continue to refine those scopes for those pilots that we're looking to develop. And so that's loosely kind of the agenda that we're looking at for this entire technology summit. We're kind of taking it, session by session. And so what we're really hoping to do today is learn from around the nation and see what type of opportunities there are in Arizona. That's hoping to set the stage, and we'll talk about that later this afternoon. So this next slide, just a little bit of background kind of leading into, again, the kind of roles and again, NACOG and Age-Friendly Arizona reached out to NCAT. I think that you'll see from this morning that they really have a great kind of pulse on these type of initiatives throughout the nation. And so we really wanted to bring them in for this kind of national perspective, as well as expertise specifically on the role of technology and how technology can help support these things. And so they're going to help kind of lead us and be those elements. And then Age-Friendly and NACOG are going to really hopefully be able to bring in various partners from around the state like we've done today, as well as kind of act as participants, because we're also trying to, tackle these same challenges as you all. And so we kind of very much want to be active participants in this. So with that, I guess I do want to kind of pause. That was a lot of information I feel like I threw out there. So before I jump in and to tell you who I am and who Age Friendly Arizona is there any kind of questions on the overall kind of scope of what we're looking at so far? Okay. Real quickly then, I guess just a little, probably should have started with the introduction, but I wanted to really kind of tell you all why we're here. So this next slide is just, again, my name is Todd Morris. I'm a mobility planner with Northern Arizona Council of Governments, or NACOG, as you can see here. There's a lot of acronyms. For those of you that don't necessarily work with the your local Council of Governments or Metropolitan Planning Organization, I'm hoping this map here kind of shows how the state is broken up by these various planning entities. But for the NACOG region, this is the Northern Arizona is very, very rural, has tons of challenges in terms of long distance, like I mentioned before. But I don't think that it's necessarily unique. And so a real reason that I'm here today is whether it's initiatives that could work for Northern Arizona, Southern Arizona, Western Arizona, I do think that there's a lot of similarities across all of rural Arizona, especially around this topic. And so, if there's solutions that can work in one area, I think that there's great opportunity to kind of look at ways that could be expanded across. But this is kind of just a snapshot of the Northern Arizona region. A lot of tribes, we work with a lot of tribes here in Northern Arizona. And just it's a highly rural area, but it's incredibly it's an incredibly diverse and it's an exciting area to work in, and I really do kind of love the region. So the next slide I think kind of continues along this, but just helps again, for each one of these councils of governments, there is a kind of one of my counterparts, a mobility manager. And so these mobility managers are in charge of kind of helping to coordinate and plan for various transportation services at that regional level, and kind of factor in the rural character or the unique character of each region, foster collaboration, and then work with ADOT or other funding partners. And so some of those mobility managers are on the call today. But absolutely, if there's any questions or how I can help put you in touch with your local mobility manager, hopefully these slides help kind of point you in the direction of which organization to turn to. So, and with that, that's kind of the rundown of how the Arizona is broken up in terms of the Council of Governments. And I do now want to hand it over to Age Friendly Arizona and Amy St. Peter for an introduction.
Great. Thank you, Todd. And thanks to all of you for coming this afternoon. It's really good to be able to spend this time with you. And thanks particularly for the comments and the questions in the chat. Really excited to be able to offer this event to you today. We've been planning this for a long time, and we're very focused on partnering with you to address the most pertinent needs in your communities, very specifically related to how can we use technology better to improve transportation services to older adults, to people in need throughout your communities, to help them to connect. And connecting is exactly what Age Friendly Arizona has been focused on since 2011 when it formed. We had some work before that too, really coming out of the Great Recession and looking at the funding reductions that had been made to programs that serve older adults and really serving people in need. And so since that time, we've been able to work with very closely more than 24 different communities throughout all of Arizona. And we've been fortunate to be able to share this work nationally as well as internationally. So thank you for being part of this. Many of you are partners in this process. Through Age Friendly Arizona, we are keenly focused on how can we help to better connect older adults with people of all ages in their communities. Often transportation is the barrier. Transportation is not just about planes, trains, and automobiles. It's about the origin and the destination. It's about getting to the people and places that matter to you. And as such, transportation is most often very much a lifeline. And so each of you in your own way really helps to strengthen that lifeline. And we're excited to be able to partner with you today and beyond. We've been fortunate to receive philanthropic as well as federal funding. Being able to partner with foundations has been particularly helpful because they can help us to demonstrate proof of concept. And then often we're able to transfer long-term operational funding over to federal sources. And so that model has worked really well for us. And we're interested in pursuing additional opportunities with you throughout the webinar today and the in-person event coming in May, and then following up in June with that final event. We can go to the next slide, please. And these are all the reasons why, and many, many more, why we're conducting this work is about helping to people. It's about helping people to engage. And it's not just about doctor's appointments or any one particular destination. It's about whatever's important to them. And so for the woman that you see with the tandem skydiving, that's a woman who is served by one of our nonprofit partners here, Sun Health. And she actually sent that picture to her family afterwards. They had no idea that she was going skydiving that day. For other people, it's intergenerational. It's being able to be outside and to be able to connect with others and to be able to improve their physical health and their overall well-being. For other people, like such as a couple in the middle, it's about connecting with others in their community and really forming those incredibly important relationships. When we think about poverty, we can think about it most often in terms of their financial poverty. Do they have enough money? But two other kinds of poverty that deeply affect particularly older adults is poverty of relationships and poverty of purpose. And transportation is absolutely most often the key to helping people establish and to overcome those kinds of poverty. So a sense of purpose. Can you get out and can you volunteer? Can you be part of your community? Do you have an opportunity to give back? Poverty of relationships. Does anyone know if you get up in the morning, do they care? And so it's about getting out into the community to see the people that you care about and that care about you and that you can connect accordingly. And so when we don't have those transportation resources available to folks, people's lives suffer. And they say that social isolation is actually worse to your health than smoking 2 packs of cigarettes every single day. And so this work is critically important. And if we can use technology to maximize our resources, all the better, because everyone who's providing this service is doing so with very limited and constrained resources. And we need better and stronger solutions in order to overcome those very real challenges. Next slide, please. This is a timeline we've evolved over the years. We originally started off as a regional effort here in Maricopa County and portions of Pinal County as well. But thanks to opportunities and in response to needs, we've grown statewide. And in doing so, we've adopted more of a rural focus, because as we move throughout Arizona, we start partnering with more and more rural communities. And so being able to partner with you, with NACOG, has been really important to our growth and to our success. And so over the years, we've adopted a pretty basic formula, and that's that we always start with the data. What are the attributes of the people in that community? The second is equally, if not more important, and that's the community engagement. What's important to the people living in that community? And then the third step is how can we develop some kind of intervention to help address those needs and to be able to tap into the talents and the resources of people living in those communities as well. And so we've been fortunate to be able to maintain this work over the years and to be able to move forward with you today. Next slide, please. And these are just some of the stats in terms of how we've been able to make a difference because of those partnerships, because of the support that we've received. We've been able to bring in a lot of grant funding as well as cash match and in-kind contributions. We liken it to stone soup, where everybody throws in what they have and together we can make something better than if we were cooking something on our own. And it's very much an organic effort, and one where we've been fortunate to be able to tap into support from funders throughout the country. As a result, we've been able to deliver really meaningful impacts to older adults throughout all of Arizona. And we've been able to work with some really talented partners as well. I'd encourage you to go to agefriendly.org online, and there you can access all of our resources. We make them available to you in ways that make it easy for you to download it, adapt it, change it for the better, and then put it into play in your community in a way that's going to deliver results in your community. And if you have questions about any of this, if we can assist you in any way, please don't hesitate to reach out. I'd like to recognize Todd particularly for helping to spearhead these efforts through this event, as well as to many others, and Dee Dee and Hezekias on our staff who help out as well really deeply and have for a long time. So we're thankful to all of you for being here today and look forward to the conversations to follow. If we can go to the next slide, please. Before turning it over again, I would like to pause and see if there's any questions, any other input from anyone. And just to call out some of the great comments in the chat. There's a question about any information on environmental illnesses and how folks who suffer from that access technology. I think technology can be an incredible resource for people, particularly when they're not able to leave their home. Absolutely looking at the comment about how infrastructure, broadband, fiber, internet infrastructure is vital. Yes, we can't use technology if we don't have access to it. And so I think those are important thoughts to bring into the conversation today. Any other thoughts, questions, elements to consider? Okay, well, thank you so much. I'll turn it back over and look forward to working with all of you. Thanks.
All right, thank you all. And then is there anything else, Todd, before we jump into our case studies?
No, I think we're good to pop into the case studies. I guess, do we want to have time for questions at the end, or do we want to just encourage people to pop in the chat or to raise their hand or something just as we're going along? Do we have time set aside for those?
We have time set aside at the end
Okay.
for questions, but I think it always makes sense if people want to throw their questions into the chat while you think of them. And then that way, especially if we're transitioning between people, we can maybe throw a couple out while the next person gets their slides up. So, so we'll keep an eye out on the chat. And then, so we encourage you to keep asking questions, and then we will get them out to you. So, with that,
real quick on the kind of case studies that we do have, I do think it's really important, and one of the things that we were really excited about being able to bring in these examples from around the nation is the diversity in them. I think that you'll see that we have examples from more kind of urban areas in Oklahoma. We have very rural areas up in South Dakota and in Colorado, and so anyway, it's just a very diverse kind of example that I think that we're hoping to bring. Kind of there's ties into each corner of Arizona. We're hoping to see kind of through these examples. So thank you guys for lassoing all these presenters in. So.
And thanks to everyone doing all this great work. So we're going to start off with Dr. Marilyn Dillon and Stephanie Davis from Embark in Oklahoma City. At my home organization, the Community Transportation Association of America, another long acronym, we worked really closely with Marilyn and Stephanie at the beginning of this project. So we're really excited to see it flourishing now. And so with that, I'll hand it over to you all. And yep.
All right, thanks, Andrew. Give me just a second here. I'm sharing my screen. You guys let me know when you can see it.
All right, got it.
We got it? All right. Okay, so as Andrew said, my name is Dr. Marilyn Dillon. I am the Mobility Management Administrator for Embark here in Oklahoma City. I do want to clarify just a little bit because John kind of, Todd, excuse me, kind of classified us as rural, as urban. I don't think I'd go there. Oklahoma City is a very big city. However, our urbanized zone that we serve through our mobility programs is 7 counties, and most of our counties are average about 720 square miles. So quite a bit of it is actually rural, even though we do have a really strong urban core. We end up hitting a lot of the same issues that rural agencies run into. And with me today is Stephanie Davis. She's going to introduce herself in a minute. She is the mobility coordinator for our Climb Ride program. And we're going to talk to you a little bit about the programs that we kind of have. So one of the things that we really try to do here at Embark with our mobility management programs is to eliminate those gaps. We really take it seriously, that partnership between public transit and human services, and making those partnerships meaningful in terms of outcomes for those human services. In other words, we don't want to just provide a trip. And so what do I mean by that? Well, what I mean is we want to focus on moving the people. We want to focus on commingling our network together. We don't want to have siloed single vehicles doing a single type of service where one vehicle is just dedicated to moving seniors around. We really want to take that coordinating council for access and mobility vision and take it one step further to where we're truly commingling our entire network. And as Andrew said, we've worked closely with CTAA, and we're moved all of our mobility program design is very people-centered. We take the time to understand the area that we're going to be working in very closely. Amy mentioned data earlier. That data is very, very important to us as well. But we also want to sit down and talk to the actual people receiving services, as well as the case managers, the others in the agency that are providing those services. So the transportation is above and beyond what we've come to believe transit really is. So here in Oklahoma City at Embark, like I said, our urbanized zone is about 7 counties. We do have a wide range of services. We have weaved together private foundation funding, local funding, regional funding, county funding, state funding, and of course, federal funding to do all of these different types of things. So we don't focus on seniors. We don't just focus on domestic violence. We have a whole partnership for crime victim support. We do trip subsidies. We have nutrition programs. We deliver food boxes. We work in domestic violence sectors, and we could do an entire presentation just on those various mobility programs and how we've kind of fund braided everything together to pay for this. Amy mentioned that proof of concept type thing where, they've been successful in Arizona with getting the data, doing a pilot, moving the needle on outcomes, and then going back to funders and asking for them to permanently fund a program. So one of the things that we also wanted to stress with you all, since this was kind of a technology showcase, you don't need a fancy software system to do quite a bit of these things. For example, our senior transportation services are a huge meld of using a local on-demand provider and leveraging their software scheduling, whereas some of our other services, such as the Palomar service working with domestic violence, that is simply, we went out and bought an iPad and a data plan, plugged it into the computer, and we use a spreadsheet to do it. Food box deliveries are done on a paper and pencil basis. There's lots of different ways for you to do this when you're integrating technology into these pieces so that you're meeting the needs of the organization within the budget that you have, while still ensuring that the participants can access the services. And with that, I am going to turn it over to Stephanie to have her kind of talk a little bit about this program everybody's been talking about.
So I'm Stephanie Davis. I am the Mobility Programs Coordinator here at Embark, specifically for the Climb Ride program that we'll be talking about today. One of the things I want to discuss is that our job as mobility managers is really just maximizing impact using existing resources. So by combining appropriate technology, public transit, and human services, we create a network of options that not only get individuals where they need to be, but we also increase their quality of life, and we see improved outcomes in a long-term way. Next slide. So how do you do this? Well, the one thing we find consistently is fragmented service models that kind of inadvertently create either gaps or duplication of services. As we'll discuss later in this presentation, the key to successful programs is communication. This involves partnering with outside agencies to identify needs, share information, and strategic use of the existing resources. We're not trying to recreate the wheel, we're just trying to get it on the road. Next, it's important to start small. A singular program cannot be all things to all people. By identifying your target population or specific area of focus, you can use pilots to test, assess, and modify processes and key performance measures. Development of technology solution is also vital. Whether it's just a simple smart sheet, as Marilyn mentioned, or a robust transit management program, you can establish a solution that adequately tracks necessary information, but needs to be accessible by all parties. Which brings me to data collection. I cannot stress enough how important it is to establish and maintain good records. At Embark, we like to do case studies. So by demonstrating successful outcomes, you can create sustainable and replicable models to be used when seeking longer-term funding sources, expanding to other services, et cetera. I know it kind of seems overwhelming, but many people are shocked to find out that thousands and thousands of rides using dozens of programs and countless funding streams are managed by our team here at Embark, which is 4 people, and sometimes just old-fashioned pencil and paper.
So, like she said, what do you need to get started? I know this is a transit technology showcase, and I certainly don't want to discourage anybody from using technology, but you don't, like Stephanie said, we don't have to, solve world peace in order to launch a transportation program. We need a paper and we need a pencil. We can do many, many things with that. We talked a little bit about proof of concept and pilot programs. This is one of our early senior health and wellness programs that came out of actually a personal health thing with me. I learned that Older Americans Act services do not cover individuals going to rehab, like a cardiac rehab program, or if they've been sent to exercise to improve their health. Many Medicare and Medicaid programs also don't cover those types of trips. So we developed this in-house. We funded it with $15,000 and a little one-page flyer brochure that we took to senior housing units. We utilized an existing provider and they cut us a deal with the service charges so that we could do a case study. We did a case study. We followed 6 participants for a year, and they were able to successfully improve their health outcomes, and we were able to secure permanent funding. So now we have a permanent budget for this program that's funded by the city of Oklahoma City, and we're able to help seniors get there. I'm going to be putting a link to some of these case study reports that we do in the chat as we go through this.
So that actually brings me to the Climb Ride program. The Climb Ride program was actually born out of a very ambitious goal of improving human service outcomes while simultaneously reducing costs. It was focused on child welfare and developed as a scalable, replicable mobility solution that provides transportation services, travel training, and case management support through a hope-centered lens. Climb Ride trips are destinations to services outlined in the court-ordered service plan given to the parents in the child welfare system, that things like visits, case management visits, counseling appointments, parenting classes, and random drug screening appointments. Next. As we discussed, there are pitfalls and problems with tech that people don't always like to talk about. So Climb Ride initially launched with the intention of developing a very technology-forward program to include an intuitive dashboard for scheduling of rides, as well as an interactive mobile app for the riders themselves. We discovered pretty quickly that the population we serve often actually has limited access to mobile phones with data plans, as well as frequent changes in phone number. So the mobile app actually created an unnecessary hurdle in the preliminary stages. We pivoted, deciding to use automated text message capabilities instead to disseminate ride details. Additionally, the demands we placed on the software shifted throughout the project. As Scott Bogren likes to say, we don't know what we don't know. For example, we needed to track data, but we weren't certain exactly what data we needed in the beginning. Later updates would include the ability to save things like frequently used addresses, create detailed rider profiles, book reoccurring ride sets, and all of which can be quickly exported into an Excel sheet for reporting purposes. We also struggled with getting the software to integrate or talk to other programs that's required for fully functional multimodal trip options, obviously. But some of our network of providers either didn't have internal technology themselves, or what was available didn't plug into each other because of monolithic architecture or legacy systems. And lastly, true software development is incredibly expensive. There are tons of companies emerging that are solely focused on just that, developing transit savvy software. But for the purposes of this particular project, we actually chose to redirect the funds and focus on outcomes. But what it did do is give us the opportunity, what we learned, and the opportunity to learn what we really needed software to do. Ultimately, we use that knowledge as a catalyst to go after an alternate funding source that will be used to procure software that will support all of Embark's family of services in the coming months. Next slide. Child welfare before Climb Ride. In 2019, when this project was launched, DHS was reporting approximately 1,100 active child welfare cases. While our goal at that time was to reunify approximately 55%, statistically, they were averaging more like 35 to 37%, and case lengths were hovering around the 18 to 24 month time period to finalize. The lack of transportation was reported as the leading barrier to completion of the service plan issued by the courts as a requirement of family reunification. Using data collected from the adoption and foster care analysis and reporting system, Climb Ride staff estimated that was averaging about $4,000 a month to support a single child in foster care. All we needed to do was shorten the time to permanency and save the state a substantial amount of funding that could then be redirected to preventative and educational services for the families. Next. Not only was Climb Ride incredibly successful at shortening the time, we average about 16 and a half months to permanency, a case being closed, as opposed to the 18 to 24 months prior to. But we also boast a whopping 63% of cases that result in reunification. Furthermore, riders report that they feel more confident in knowing what transportation resources are available to them as they continue to care for their needs and the needs of their families. And to date, we can actually report a 0% post-reunification recidivism rate as well.
Yeah, we are quite excited about the Climb Ride program, and I mean, our senior health and wellness program was hugely successful. This one is generationally successful in terms of what the impact this is going to have on our community going down the road. We are actively working with the Department of Human Services to scale Climb Up. While this particular version of Climb Ride was focused on the child welfare system, there's no limit to what this can do. This could be in developmental disabilities, mental health and substance abuse, workforce development, disability related services. I could go on and on and on. There's not a program that you could not take Climb and mold it to be something else, what it needed to be for those individuals. I noticed a comment in the chat about the phone number stability for seniors from Todd. Todd, that is very income dependent here in Oklahoma City in this area. Phone number stability is directly related to what level of public assistance they're on and what their income level is. We find people that are on public assistance here, or anyone that is, you know, more than 300% below federal poverty level, they're going to change their phone number because they can't afford to keep a plan long term. So they're just going to get burner phones when they have the money to do so. So the phone number changes all the time. Okay, so we wanted to talk a little bit about what our actual local mobility network looks like. So we keep talking to you about our providers and how some of them have technology, some of them don't. We work with 5310 agencies. We work with regional providers. We have a couple of local providers here that are just within our city. We even have our own local transportation network company called Senderide, which is very beneficial to us here in Oklahoma City. We are working right now to execute some shared use agreements with some of the 5310s and the nonprofits to do vehicle sharing here in Oklahoma City. So all of that to be said, we're really focused on shared ride, on coordination, on commingling services within the same vehicle for efficiencies here, while at the same time coordinating with our state. Todd showed the map early on of Arizona's statewide mobility network. We are working towards that here in the state of Oklahoma as well. We currently have 2 pilot programs, one in the southern part of the state and one in the northern part of the state, that's trying to replicate what Embark has done here in Oklahoma City in some of the more rural areas of our state. So we're very, very excited about what is happening here in Oklahoma. So what did we learn? Well, Stephanie's going to tell you a little bit about what she learned from the participant side. And I want to tell you a little bit about the big thing that we learned from my side from being a program administrator was the importance of that collaboration piece. It's your very last bullet point on your slide. That was intentional, so I could say that needs to be first, not last. Because that collaboration piece is what made Climb so successful. The collaboration between the Oklahoma Transit Association, the Community Transportation Association of America, Embark, our Oklahoma Department of Transportation stepped in and helped us out with a lot. And of course, our funding came from a private family foundation here in Oklahoma. And with that, I will let Stephanie tell you about all the other stuff we learned.
I mean, really, one of the biggest things is to listen to the participants. You know, one of their biggest hurdles they have is that the pre-scheduling, for example, with outside providers, you know, often they're at the mercy of time changes and things of that nature. You know, just kind of helping them to learn to manage their own schedules, writing down the details of things and being able to convey those to the agencies. You know, just having accessibility and being aware of their available resources in their area. So not everybody's on a fixed route system. Not everybody has the same, you know, Sooner Care, which is our local medical transport. Not everybody has all of those options. So tailoring it to customize to the individual rider was truly important. And the only way to do that is to learn their needs and their habit and their ridership patterns.
Yeah. And with that, I think we're at the end. We do have our, this is our main email address. It goes to our entire team. Like Stephanie said, there are actually only 4 of us. We do a very large amount of rides every year for there to only be 4 of us, including our paratransit services that we offer. We do between the 4 of us about 210,000 trips a year. On everything from paper and pencil manifest to a fully coordinated scheduling software system. So it just depends on which program it is. I also put links to both of our case studies that are up right now. And I'm trying to find a Science of Hope link. I wanted to give you guys that as well. And with that, we'll turn it back over to Andrew.
All right. Thanks all. And so while we, I'll double check if Barb, if you are ready from Prairie Hills, then once we get Barb on, then so Todd put a question in about asking if you could talk more about the private foundation. I think we'll, you can give like a 1 sentence now, and then we'll dive into that after we.
So there's a local organization here called the Arnold Family Foundation. It was a $1 million 4-year grant. Our charge was to reduce the time the individuals spend in the child welfare system, as well as improve the reunification rate, which we did both. Plus, we also managed to make it with using the Science of Hope. We haven't had any recidivism in that program either. None of the families that were reunited have come back into that program since 2019. Those families are stable now. Some of those individuals are even doing counseling now. How are we sustaining it? We came in 18 months under budget. Our grant runs out next month, and the foundation has given us an additional 18 months to spend out the grant because we came in so far under budget. We are in the process of talking with DHS right now about sustainability because I know on the one slide, Stephanie said it was $4,000 per child per month. It only costs $4,000 to do an entire program's transportation for a year. So all we have to do is shorten their time in the system 1 month. And after that, everything out every month after that is just savings to DHS that can be used for other programs. That's why we focus on outcomes, because when you focus on outcomes, your costs go down, you have savings, and people are much more likely to invest long-term in that program.
Right. Yeah. So the foundation provided a great opportunity to really address that challenge there. So, so Barb Klein, if you're able to, if you're there, I see your screen. Might end up with tech issues, but in the oh, there you are. All right. So first off, thank you, Marilyn and Stephanie. And so, so now we are going to go over to Barb Klein from Prairie Hills Transit in Spearfish, South Dakota. And then you'll all still have a chance to ask more questions once we get through this set of presentations. So we're going to keep on going for the time being. So Barb, if you're all ready to go, then I am as well.
I'm good to go. If you want to go to the next slide. What I'd like to tell you a little bit about this morning is a contract that we've had in place for a number of years with our local healthcare group. They are the major healthcare entity on the western side of South Dakota and cover most of the area that Prairie Hills Transit provides service in, which is 12,500 square miles. We've got hospitals, clinics, a couple assisted cares, rehab facilities, just a whole cadre of what you would expect from a major healthcare entity. But they came to us, they said, we hear good things about you, you've done great things with transportation. We want to be the people that provides healthcare. We'd like you to provide our transportation for us. So through the years, we have transitioned from a single vehicle. We have been able to provide for them the right type of transportation when a patient needs to be released. For instance, if someone has a wheelchair, our vehicles are ramp equipped. Some of them have bigger chairs, oxygen, we're able to accommodate everything but an ambulance type release. But they give us a call. We have a system set up where we know where the people are going, what their needs are, who to expect at delivery.
Hey,
When-
Barb.
Yeah,
Hey, sorry. I think we're getting some comments in the chat that I'm curious if there's a microphone you could sit a little closer or talk a little bit closer to the microphone. It's a little hard to hear you at times.
okay.
There you go.
I'll
That's
try
great.
to- Is that better? Okay. I feel like I'm sitting on my computer, but I'll do better.
All right. Well, thank you very much.
So when a hospital is close to being full, one of the things that they really don't want to see, and if we have a loved one in a hospital, we don't want to see it either, is when they have to divert a patient to another hospital. It's not only difficult for the patient, but it's also difficult for their family, especially if it's an extended stay of any type. So it's important for them and us to get those people out of the hospital and to their own homes or assisted cares, wherever they're going, as quickly as is possible. Occasionally, they will be able to discharge a patient to a hospital if there's an overnight stay or something, just so they can help out with that. That's not really the preferred method, but it is available. So what the hospital wants to see, the nursing homes, wherever people are located, is that the transportation experience is a positive one. So those of you in the transportation business know we put a lot of time and energy into training our drivers, making sure that they are providing standards of excellence that any of us would want in that same situation. We're incentivized to obviously produce those long-term outcomes because we're reimbursed daily rates, sometimes hourly rates. And with them, they're able to assure that they have better patient care outcomes as they begin releasing folks. So by being able to ensure folks have those follow-up care appointments, they can also reduce the number of people that are coming back into the emergency department because they haven't been able to meet their follow-up care plans. Andrew, with me? We've had that contractual agreement with them since 2012. And I think one of the important things is that in these 11 years, we have never billed Medicaid anything for any of the trips provided through Monument Health. We certainly could. With their continuum of care, they feel it's their responsibility, which is not like a lot of healthcare systems that we see across the nation. They're gonna push those trips off as quickly as they can. We're not seeing that at this point. We're positioned to do that if we do or want to. At that point, or at this point, there are no Medicaid billings for individuals using transportation through this contract. We started out with a single bus because, quite frankly, 11 years ago, I didn't have the money to buy a bus. I said, we'd love to enter into a contract. We don't have money. I'll find you a bus if you'll pay for it. And that's how we originally started out. So we morphed a little bit with that. We traded in that first cutaway bus. They bought us 2 ADA vans. Just January of this year, we traded back those 2 ADA vans and they bought us 3 ADA vans. So through this whole process, it's important to know that if you give your people the right information, they're going to support you in what you do. And I think the investment that they've shown, especially with the price of vehicles right now, has been very consistent with the outcomes that they want us to see. The vehicle contracts vary just a little bit. Vehicle 1 is a 7-day per week vehicle and it operates from 10 to 6. Vehicles 2 and 3 are 5 days per week and they operate 9 and 6. Any service that we do outside those parameters and our other vehicles are billed at a per hour rate of $54 or in 15-minute increments. So we're always able, not always, but most often able to provide backup trips if they're outside the 2 or 3 drivers that are working a particular time frame. We do work every day except for 5 major holidays. And we provide a courier service for them 4 days a week where pick up lab samples and offer people transportation. It's about a 70-mile trip one way and back. So they're billed with any of those, either type trip outside the contract. Andrew? This is the type of coverage that we have, a $2 million liability coverage. We provide all of the maintenance in our own shop for the routine and standard maintenance that needs to be provided on all vehicles that are funded with FDA dollars. We obviously have good and proper business records that we retain on vehicle maintenance, but also good and proper records that go to Monument Health with each monthly billing, so they know what we've been doing, where we've been going. And they do some really cool heat charts so they can know where trips start and where they end. And they're kind of fun to see when they do those monthly and share those with us. We do have 2 full-time drivers, a part-time driver. They follow all the same guidelines that we do with training with our other drivers, pre-employment drug screen, background checks, and randoms as we go through each quarter. The role of technology for us is also important in this because the drivers receive their work each day on a tablet. So they know exactly where they're going, pickup location, destination. It has GPS so they can tell about how long it's going to be if they don't know that in advance. And all of these drivers are able to cross state lines because we do a significant amount of trips outside the state to deliver. Andrew? We just want to note that their payment method's different, and if we aren't able to meet transportation and they can't find a hotel or the person isn't able to go without an attendant, this is some of the costs that they can expect to incur. Costs them about $700 to $800 if a discharge doesn't occur. Normally those are not reimbursable costs. And just to do the math, which I think is always kind of fun, 200 of those trips would be between $140,000 and $160,000. Which is a big hit to a budget, even if they are a large company. They're incentivized by Uncle Sam to make sure that they're producing those long-term outcomes. And so it's important to them. Again, it's not just the customer care, but it's also business driven. Recent study of a single clinical setting showed that over 445 scheduled behavioral health visits were missed due to lack of transportation or a person's lack of ability to fund that transportation. And I think in rural communities, sometimes it's not as significant because little communities will more often take care of their people. The biggest hospital we have is in an urbanized area. So they not only work with us, but they have the ability to work with their fixed route system and their paratransit system. Andrew? So we like to think that they're right sizing their transportation, although sometimes they call us first instead of reviewing the other options that might be available, might be more cost effective for the healthcare system itself. But oftentimes these people are coming in either by ambulance or, well, by ambulance, both air and ground. They do a lot of air support. So people come in without a way to get home, for obviously a choice that they select. But when they get to the discharge piece, I will say that a lot of those trips are going back to tribal reservations because their transportation systems don't work weekends. And oftentimes we're told that when their buses do come to the urbanized area, they are already, they don't have room to take somebody back that's getting out of the hospital. Obviously, ambulatory people do have more resources and ability to be more selective in how they want to go home. If they don't want to use our service, they can use Uber in some cases, Lyft. But for the most part, anybody that has mobility challenges will be using Prairie Hills Transit. And it doesn't make any difference if they have more money or not, unless they already have a vehicle at home that's, you know, outfitted for their wheelchair or mobility device. Lots of people have circumstances that happen, and I know for those of you that maybe know what the Sturgis Motorcycle Rally is, we lots of times are taking people back to the airport so they can fly, but they have leg extensions, they've broken bones, whatever. So even air transportation, where they're linked to get them from the hospital to the airport. The hospital is willing to subsidize our transportation service to help to make sure people are able to do this. And in many cases, we're moving people from nursing homes to dialysis in other communities. Resources are slim here. We've got a number of dialysis units. Most of them are running at least 2 shifts and weekends. And for people that need to be released into a nursing home, for instance, in our area, they actually call us first and say, we have a person that we would like to admit, we have a new resident, can you fit that into your schedule? Because this is the dialysis times that are available, chair times. So they definitely want to make sure that they have the ability to get those people to dialysis. Andrew. Hello, Andrew? There you go. So just some talking points, and I think that if you have 435 missed appointments to follow up mental health care, I bet every person in every community on this know of somebody that isn't receiving appropriate mental health care because they can't get there. 3.6 million Americans are missing or receiving delayed medical care and mental health care due to lack of appropriate transportation. For us, what we were seeing with the rapid transit system, their paratransit system, was that the driver would go to the person's home and they had like a 3-minute window. Well, dialysis people don't move super quick. Oftentimes they're in wheelchairs. That takes them a little time to get up and get going. They're already pretty fragile, pretty weak. So those people were missing dialysis appointments when they were on a paratransit service that had strict time. So we've tried to be a little bit more flexible with that. Get to know the patients maybe a little bit more because we're smaller and we're set up a little bit differently. And one of the quotes from the person that we work with at the healthcare is that health systems and transportation providers are uniquely positioned to help each other's interests. The specialized non-emergency transportation contracted between Prairie Hills Transit and Monument Health is is a shining example. The partnership is growing into something much larger than expediting hospital discharges. They really value what Prairie Hills Transit does. We routinely call and we go, yeah, we had this really weird situation come up. We work through it together. It's all about communication. And I can tell you for 11 years, we have not really had any major conflicts with this company. They are just amazing to work with, as are the drivers that we have hired to help with this contract. Andrew? So this is some of the intended benefits, and I have a couple that I'll add at the end, but we've been able to provide increased follow-up appointments for mental health care with our services. We have ability to return people home from the emergency department where oftentimes somebody comes in, whether they come by ambulance or whether somebody drops them off or however they get there. Oftentimes police departments are dropping people off. They still need a ride home, and we're able to help provide those services. We do have the ability to provide Medicaid services once these people go home, if they're living independently or if they're living in nursing homes. So that financial hardship is averted because we're able for medical appointments to use their Medicaid benefits for that as long as they're transportation eligible. We have improved access, and again, the majority of our vehicles are ramp forklift equipped. Even those that are outside the 2 or the 3 that we operate specifically for Monument, they don't have an application period to qualify like you do for transit services. And most recently, a benefit of this whole thing is that Monument Health gave us land to build a building on. We have FTA approval. We'll be starting that construction sometime this year on their campus. So that was one of the benefits that going into this, I don't think we ever thought we would need, but as you've seen the growth from 1 vehicle to 3 vehicles and the number of trips that we do, they continue to increase and grow. So I think that's all I have. If we have questions. Right, Andrew?
All right. Thank you, Barb. And yes, does anyone have a question while I pull up our next set of slides?
I have a generalized question, Andrew. This is Marilyn.
All right.
I'm kind of curious if there's anyone that's on this call that's had any success in actually partnering with the dialysis providers to kind of coordinate residents' addresses, scheduling of the transportation, and making sure they're going to the closest dialysis center. Just curious, since you kept talking about dialysis, it made me think of that. So.
Dr. Dillon, I can speak to that from kind of a shorter term example. So it used to be in our region that the county would provide special transportation services, and right around the time of the Great Recession, they had to discontinue that because of lack of funding. They had notified the patients or the clients who were receiving those transportation services, but particularly in Wickenburg, very rural area, people just were not able to secure their own transportation. And so I was able to contact the dialysis centers, get a sense for how many people were needing assistance. And then we're able to work with the town of Wickenburg, Valley Metro, who's our transit authority, and FSL, or Foundation for Senior Living, to be able to put transportation services in place. So that was kind of a shorter term solution until a dialysis center eventually moved there years later.
Gotcha.
Very good partnership.
Wonderful, wonderful. Andrew, I apologize, but I have to go to the state capitol for Oklahoma Transit Association meeting because, well, I'm the board chair and they kind of expect me to show up, but I'm going to leave you all in the capable hands of Stephanie for questions. And I really do appreciate you taking the time to let me speak today. Thank you.
Thank you for joining, and good luck today. All right.
There's one question here, Andrew, before we turn it over. I think for Barb, in case we lose lose her at all. About hospital discharge transports to particularly, do they include pharmacy pickups? I think that's really relevant. I'd love to give just a minute for that.
Not necessarily with this particular contract, although a lot of times when individuals are coming out of the hospital, there's a pharmacy right in the hospital, so they have us pick up their meds along with the individual that we're transporting. So that's, I mean, yes and no. Once they're discharged, do medical trips to the pharmacy for them if they need.
Okay, thank you, Barb. And I can bring that up for conversation this afternoon as well. Great question. Thank you, Sam.
All right. So next up, one more presentation before we kind of really open this up for full Q&A, but we have Sagan Falconer from Invita Health in Colorado Springs, Colorado. So on another technical assistance center that exists, the National Center for Mobility Management, we got to work with Invita on this in the very early days. So it's exciting to, whenever we get to talk about this, I'm really excited. So with that, Sagan, I'll hand it over to you.
All right, perfect. And I just want to confirm that you're able to hear us.
Okay, I could hear you. Someone said it was a little choppy for a second.
You can hear us? Okay, I'm going to try disabling video. Does that help at all?
Yes.
They're talking.
Okay, perfect. So good morning, everyone. My name is Sagan Faulkner, and I'm the writer and development manager at Invita. And today I'm going to be presenting on our Ready Launch grant, the research leading up to that grant, and how we continue to expand our project by leveraging various grant opportunities. I also have Gail Nels, Invita CEO, in the room with me to answer any questions after today's presentation. All right, next slide, please.
Next.
Okay. And next one as well. All right, so I wanted to give a little bit of background information as to how this project got started. So back in 2018, we received an NCMM grant, their Healthcare Access Design Challenge grant. And what this grant allowed us to do was research what exactly prevents behavioral health and substance abuse condition patients from receiving that they require. And in our research, we found that transportation is an issue for 94% of behavioral health clients. So with this specific grant, we actually conducted in-person interviews with patients, healthcare providers, and transportation providers, and we found the following. So we found that when we interviewed clients that 35% owned their own car, 56% relied on public transportation, 44% either walked or rode a bike, and 27% relied on rides from family and friends. And we also found out that 52%, or actually these next percentages are all because of lack of transportation. So 52% due to lack of transportation for a doctor's appointment or a therapy appointment, 29% missed support group meetings, 31% missed picking up medications, and 17% gave varying responses, including missing work or job interviews and probation and parole meetings. So when we asked these clients what exactly could fix these issues, all of them reported the exact same thing. They said that it was Colorado Springs' current system of bus passes and private fixed transit. Next slide, please. All right, so when we interviewed healthcare providers, they reported that 94% of clients deal with transportation issues often, 6% of clients deal with transportation issues sometimes, 50% or more of their clients struggle with reliable, consistent transportation, and 50% or more of their clients have missed appointments due to lack of transportation. And finally, we interviewed transportation providers as well, and they said that about 20% to more than 50% of transit riders have behavioral health issues. And of these transit providers that we interviewed, they also said that they only feel somewhat equipped to deal with mental health episodes. The research and information that we collected under this grant opportunity actually leads us right into our Ready to Launch grant. Next slide, please. So what did we do with that information from that previous grant that we received? So the intention behind our Ready to Launch grant was to develop a health transportation portal, which would result in 3 things. The first thing was increase access to care, and then we wanted to improve health outcomes and also reduce healthcare costs. Through this grant opportunity, we also wanted to provide transportation services for behavioral health and substance use disorder appointments. We also planned to partner with 4 healthcare providers that specialize in this sort of treatment. We wanted to provide training to partner healthcare providers so that they could successfully use the health transportation portal. And finally, we wanted to involve a mobility healthcare manager to help coordinate our efforts across providers. They would facilitate the exchange of information, and they would also help individuals achieve their health goals. All right, next slide, please. So as we all know, things rarely go as expected. So what did the project actually look like for us? Well, of the 4 intended partner healthcare providers, only 2 engaged in the project. 1 provider could not participate due to internal personnel changes, and the other did not respond to our invitations to start training. This project also allowed us to bridge the gap between patients, healthcare providers, and transportation providers. Of the 2 healthcare providers that did engage in the program, we were able to train them to use the portal, and they were able to book appointments for our patients, so that they could make to their next appointment. And as far as the implementation of the health transportation portal, this was important, and this was especially important after what we learned from our previous grant, the Healthcare Access Design Challenge grant. So this portal helped reduce anxieties and concerns around figuring out how the patient was going to make it to their next appointment. So as soon as the appointment was over, the mobility manager was able to coordinate with them as far as what their schedule looked like, and they wouldn't have any sorts of anxieties as to how they were going to make it to their next appointment. They were able to figure that out right then and there. In our program, we had 113 clients involved, and of those 113 clients, 80 clients actually completed more than 1 ride. All right, next slide, please. So this next slide shows some of our project outcomes. The table shows a breakdown over the course of November 2019 up until May 2020. And it shows total number of rides scheduled, total number of rides completed, percentage of completed rides, number of no-shows, percentage of no-shows, cancellations, percentage of cancellations, and number of riders. And in the 3rd row from the bottom, you'll see 2 numbers, one of which is black and the other one is red right next to it. So the first number represents cancellations within a 24-hour time frame, and that second number was actually cancellations due to COVID. And on our next slide, we actually have a short video for everyone, just kind of showing what exactly the program looked like.
Studies show that lack of transportation impacts one's ability to access behavioral health and substance abuse care. Lack of transportation could mean one doesn't have a license, doesn't have a vehicle, or simply is having difficulty with the transportation options available. Specialized transit has been around for many years. In fact, in Colorado Springs, NVIDIA, formerly known as Amblicab, has been delivering specialized transportation since 1971. Through our relationships with healthcare and transportation partners in the community, we embrace the challenge to identify a solution and overcome transportation as a barrier. We call it our Healthcare Transportation Portal. It's a way that healthcare providers can work directly with transportation to request rides on behalf of their patients. It's a technology solution made possible by new software being developed in the transportation industry. Imagine a healthcare provider when scheduling a follow-up appointment for a patient. Suppose the patient says she cannot make it because she doesn't have a car. Or maybe the provider asks the patient if she needs transportation and the patient says yes. Through a transportation portal with the healthcare provider, frontline staff can request rides for patients directly with the transportation provider. The transportation provider receives the request, checks the schedule, and schedules the ride. From there, transportation works directly with the patient to confirm the ride and arrange pickup and drop-off. Rides are paid for through Medicaid NEMT, and the transportation provider can bill directly or through contractual agreement between the transportation and healthcare providers. This type of transportation can be door-to-door or even door-through-door for those who need assistance. Transportation providers like NVIDIA need only a contract carrier license through the Public Utilities Commission, which is a requirement in Colorado, to be licensed to deliver NEMT and have the appropriate software to connect with their local healthcare providers. With the Healthcare Transportation Portal, patients need no longer be anxious about how they will find their next ride.
Excellent. All right, so as I discussed earlier, the project started out with an initial research phase, and as the project continued to grow and evolve, or it continued to grow and evolve through additional funding. So shortly after our Ready to Launch grant in 2019, we received an FTA ICAM grant to expand transit services supporting behavioral health in Teller and Park counties. And these are two rural counties just west of Colorado Springs. And despite setbacks due to COVID-19, through our networking and building trust with clients and providers, we were actually able to surpass our number of rides that we had projected. So initially, we only wanted to provide roughly 335 rides, but we were actually able to provide 581 rides. Then in 2021, we actually leveraged another grant opportunity, which we received from the National Rural Transit Assistance Program, and that helped us expand our project even further into Teller County. Next slide, please. So this slide, I kind of just wanted to touch on some of the key takeaways from our project, some of the lessons that we learned. So we learned that building relationships and trust with local clients is key to a successful service launch, especially in a rural community. We also learned that employing drivers who are familiar with the local community was also important, where individuals are used to knowing the people that they work with and provide and receive services from. We also learned that branded vehicles was also important. So just having the name, our name NVIDIA on the side of the vehicle. And then we also realized that it was very critical to have support of a healthcare mobility manager or someone similar to this position, just because they helped us develop relationships and improve the health outcomes of our clients. Another thing that we learned from these projects is that there are alternatives to providing direct transportation service, such as Medicaid's NEMT reimbursement program. So with this program, we were actually able to support a less populated community and save on the expense of a driver and a vehicle, which may have only provided 1 to 2 rides in that rural area. And then lastly, like I mentioned, this project was impacted by the COVID-19 pandemic. So just being flexible in our approach, that was also important, and another lesson that we learned from the project. Next, please. All right, so where does our project stand now? So since the rollout of the product, this program has folded into our day-to-day operations. Not only has NVIDA experienced internal changes and some turnover, but also our partner agencies as well. So with that being said, we haven't had the opportunity or capacity to train staff of our partner agencies. However, in the future, we do intend to bring this program back just because we were able to achieve the goals that we set out to achieve. And those were increasing access to care, improving health outcomes, and reducing healthcare costs. And that should wrap up our presentation.
All right, thank you all. So now we'll open it up for questions for all three of the agencies we've heard from so far. And then after that, we'll have a couple more presentations, but we wanted to give people a chance for more of a conversational time. And so Eric just dropped Sagan's contact information, there we go, into the chat box there. But does anyone have I see Todd, you have raised your hand.
Yes, now I need to figure out how to lower my hand. Yeah, I guess, and I know that it may be tough to pull it back up, but I do think that in the Prairie Hills example, just she had a slide about the cost to healthcare to hospitals about the discharge process. Yeah, I was hoping we could just pull that back up for a second, just to kind of digest this a little bit more. And I guess I'm just curious if in anybody from Arizona's side of things, is this similar things that we're hearing from hospitals about? I mean, these costs, I mean, these seem like pretty stark amounts. It just seems like a great opportunity to leverage and to start conversations with some of the healthcare providers. And if not, maybe this is a good source of data that we can have to research and to kind of look into on our end as well. So anyway, I just thought that was a great piece there. Or maybe a question is to Barb, how did she come up with this information? How did she start that conversation?
Well, can you hear me okay, Todd? Okay, so yes. We've been in business for 35 years. I'm the founding director, but for many years we had provided nursing home transportation for a significant number of the facilities that were owned by Monument Health. So they came to us, actually. It's a conversation we'd had with a lot of their hospital administrators, their clinics, even before we provided transportation, because they knew we were doing so much of the work for people. So the conversation was, they came to us and said, we feel like we need more long-term service to help our residents, in particular with hospital discharges. I don't know, I can't remember how many beds their hospital is, but again, it's the largest one in half of South Dakota, if you will. So they came directly to us to request that. Now, I think the same thing could be done by any of you starting that conversation saying, we're aware what it costs you to have somebody in the hospital for additional days if they don't need to be there. I mean, they don't usually throw somebody out on the street if they don't have some place to go. But I think if you start the work from the standpoint of, we've got the resources to help, we have a contractual rate for them each day. So every time our buses are in service, even if they sit, we get paid the same. If the drivers are on the move, obviously, they're getting paid, but we don't have very many of those days anymore. Maybe in the very beginning we did. And so being able to justify that you can help them move their people between even clinics and facilities. These guys have about 6 other smaller hospitals. I would say about 100 specialty clinics in our area. And so they don't want to be in the transportation business. What they do want is to be able to get people in and out of appointments in a timely manner, because every time they have a missed trip, a doc sits there, has nothing to do. Obviously, we're paying the docs whether they do anything or not, and their staff and their receptionist, you know, the whole gamut of how that goes. So it's really a benefit for them when they start thinking about the long terms of how we can get people to and from, in and out in a timely manner, safe, efficient. They know what kind of training our drivers have. And in this particular case, they did have a company that did ambulatory services, not in a very respectable manner. I guess you could say they're out of business, so I can say that now. But they don't want to just turn their people over that are coming out of the hospital. I mean, even if you're ready to leave the hospital, you're not always in the best of shape. So they want to make sure that we're getting them where they need to be in a safe and reliable manner.
That's great. Thank you very much, Barbara. And I guess I'd imagine that it also there are opportunities as well as if you're traveling to the hospital to take somebody home, that there's efficiencies or opportunities to take people to the hospital, right? I mean, that it could potentially be working in both directions, or maybe that's a vision for down the line.
No, it's not. And we work really hard. We're actually to the point now we have a scheduler that pulls all of those trips together. And then we've got probably 20 other drivers in surrounding communities. We have 16 other communities. So that person is looking at what everybody's work is. And if one person, you know, can pick up a couple people, take them to the hospital, they can pick up that discharge, take them home, it's a win-win for everybody. So good question.
So I noticed in the chat that Sam Johnson really identified with Envita's program in that they are almost exactly the same. So, so Sam, if you want to talk a little bit more about that, or
sure, I'd be happy to.
how you feel about the program.
It's just a pilot program at this stage. We only have 5 vehicles total, and one of them is partnered with a local hospital. But I was just impressed with the almost exact synchronicity between your video's description of your program and what we have set up. It apparently must be a good model, I hope. So it's basically the caseworkers are the ones who book and schedule the rides via a transportation portal that we have set up for them. So that's all automated. Once they put in the patient's information, where they're going, what they need to do, pharmacy pickups. That's actually our big challenge right now, is coordinating with all of these follow-up care appointments, and everyone has different internal logistics. We've already observed this with the hospital itself, and they've been absolutely fantastic at working with us. The collaboration there is really great. They set up this thing called a discharge lounge internally to help streamline the patient discharge process. But it's all of these other healthcare providers. And what I'm realizing in the field of transportation is we touch on so many different connections, and it really, I feel like it almost comes to a point where we have to figure out everyone's internal logistics. maybe I'm going too far off topic here. I'm just curious if other people have this experience as well.
From my view, from kind of the much higher level, is the knowing the partner's logistics helps a lot. So if you understand the office processes of a hospital, but also smaller clinics, and then if you suggest something that does not fit their workflow, then the chances of them partnering with you are quite low to nothing. So so understanding how that works and how you can kind of mesh everything together is a pretty critical part of making any of those partnerships work.
I think I'd, if you don't mind, I'd want to clarify though, it's about solving the overall logistical challenge. Many agencies are experiencing internal logistical challenges, such as pharmacies are just, backed up by 2 days. They may get the order within 30 minutes, but they won't fill it for another 2 days. So, as a transportation, agency, I'm just curious what the limits of our ability are to meet these logistical needs.
Just to piggyback on that, I think that kind of definitely speaks to the heart of a lot of the challenges that we see, is that, and this is probably better position for the conversation this afternoon, but I do think that there's just not a whole lot of resources for us to have any inefficiencies whatsoever. But yet we are kind of constantly, from a transportation side, faced with all these inefficiencies of pulling up to the pharmacy, right, and that prescription's not there that we had scheduled it in to be there. So, and that's kind of what the spirit of this whole summit conversation is trying to figure out ways to, improve some efficiencies, because we just absolutely don't have room for things to continue to operate at the inefficient levels that they are. So just that's my 2 cents on that, and hopefully that's what we're find some ways to chip away at that here today.
And to elaborate on that a little bit, that's a great kind of just primer for day 2, and then even into day 3 of this whole bigger vision process. That hopefully, through this process, you'll be able to narrow down to who your local partners are if they're not here already, who they need to be, what then that work is going to be over the next many months and many years. So these are just some kind of things that we're putting pins in along the way, and continue to flesh them out as this process rolls on. So great point, and there will be a lot more to come on that.
Any other questions or thoughts?
Sorry, I know I'm talking a lot in this, but I am curious, from the Oklahoma City team, do we still have participation there? Yes, Stephanie. I know you mentioned commingling trips, and I guess that's something that I've kind of been thinking about throughout all these presentations, but the commingling trips, just curious if you could speak a little bit to that. I'm thinking of examples in rural Arizona where we do actually have decent amount of behavioral health services that are out, but we have needs for senior transportation. And so there's kind of a mismatch there. And I think that there are a lot of times there's stigma associated with that, but I'm curious if that's anything you guys ran into in Oklahoma City and how you addressed it.
Absolutely. So it takes a little creativity, of course, but as we've been kind of discussing, it's bringing everybody to the table. Find out who has vehicles, when are they using them, that kind of thing. What are they using them for? We often do things. For example, Marilyn mentioned the Palomar Family Justice Center. We actually have a vehicle that is Embark operated. Our driver actually operates that vehicle and is housed out of Palomar. And when that vehicle is sitting, we will often put climb ride participants on those vehicles. We also have an adult daycare center here in the Oklahoma City area that has vehicles that they use to transport their patients, to the facilities in the morning and home in the evenings while they're sitting during the interim part of the day. So we have partnered with them to use those vehicles in the interim to take seniors to non-emergency medical transports and things of that nature. And then subsequently they bill us for using those seats It helps them offset their maintenance costs and things of that nature. Helps them, maintain their vehicles and keeps vehicles from sitting, keeps them on the road, keeps them using them. So that's how we get creative in our areas, because yeah, like we mentioned, not every community has all exact the same resources everywhere you go. So, and you can utilize that, especially as you get into more rural areas where you have local organizations that have vehicles that maybe they're not using 24 hours a day, but somebody can, be sitting in those seats. So maybe this patient is going to pick up their prescription while this one's going to their substance abuse counseling in a similar portion of the area. It's just coordinating those resources and in the most effective and efficient way possible.
And I just got a message. Segan, feel free to unmute and jump in.
So thank you. This is Gail. When we were doing some transportation for behavioral health rides, what we found though was commingling was not appropriate. On some behavioral health rides it was, and others not. While talking to the executive director of the local chapter of National Alliance on Mental Illness, she described it as some of the people we're transporting, it takes all they can do is to even make the phone call to commit to going to, some kind of joint therapy session. So then to have someone else in the vehicle with them puts them over the edge. And it was around maybe an anxiety diagnosis. So we thought we had to develop a stronger relationship with the NAMI partner and who they were, looking to schedule a ride for, to what was going to be an appropriate transportation for that person with that kind of diagnosis. So commingling is great, except it works when it works and it doesn't when it doesn't. And frankly, it was tough on our driver to have someone be so violently opposed to getting into a vehicle with another. So it was an interesting point for us to learn.
Mm-hmm. Absolutely. And Todd, if I could just jump in too. So, and I do agree. I think a lot of care really needs to be taken to see who can share that ride and who just isn't in a position to really share at that moment. And it's interesting because we see great examples of both scenarios playing out. I know we were working with Payson with their senior center there as they were developing a new kind of first mile, last mile kind of trip, which was fantastic. And that was part of our rural transportation incubator. And they had found that people, and so they did share rides. And because it was appropriate with that population, and they found that people kind of jockeyed to be the last one dropped off because they wanted to spend more time with people in the van because that was part of their socialization. So it was really neat too, because they developed this really strong sense of community, and the journey was just as important as the destination in those cases.
Well, and I want to add to that, it is important in any program. It doesn't matter if it's medical, senior, behavioral health, whatever, to have a decision matrix in place that says this is an appropriate option and this is not an appropriate option. So.
Actually, could I follow up on commingling? Okay, I'm just curious about some of the challenges around insurance and funding. I know you mentioned that you bill the partner whose vehicle you borrow. I'm just curious if we were to, I know there are some models like this kind of going in Arizona already. I know I keep hearing Billy Parker's name and ARC, but I'm really curious how we could begin to set up something like this, like around the Human Services campus, for example.
We have individual contracts with local agencies that have mostly, to be honest, have reached out to us saying, hey, we have vehicles, what can we do with them? How can we help? So we have individual contracts with them that outline what services, excuse me, what services they will be able to provide for us. For example, some do not provide the social services side, but maybe they do the senior services. It really depends on the type of vehicles they have available, the number of drivers they have available, what kind of capacity that they're looking at. So we have individual contracts that are set up on renewable usually yearly renewable, outlining what the charges are, what hours they're available, what type of services they're willing to operate under. And we have, one of those with everything from, smaller agencies getting funding from the federal government for their vehicles, all the way up to, local TNC providers, Uber and Lyft, for example. We have some smaller mom and pop type agencies in the area, community action agency, all of those. So.
All right, and just to piggyback onto that, we find that often the barrier there is the insurance, because the insurance provider doesn't want to allow you to share that van, and they'll act like, oh, well, you just can't do it. But we found that when agencies really push and say, well, that's fine, maybe I'll find someone who can, then they relent and say, oh, well, maybe you can in these circumstances, as long as you have this training in place and things like that. I know Dee Dee and Hezekiah have been working a lot with their providers too, trying to crack that nut, because it's tough. I mean, you have somebody telling you can't do it, but then really you can. It's just a matter of finding the right insurance provider sometimes.
All right. Any other thoughts or questions? And then if you think of anything after the fact, which I usually do, we're also happy to pass questions along. Any others at the moment?
The healthcare coordinator with the Colorado Springs approach, are there HIPAA considerations that they have to navigate? And how do they?
So yeah, this is Gail. We have, because in our state, we were granted the privilege, I guess, to go into the Medicaid portals. So we are all HIPAA trained, and we have all those agreements in place. And so, and then of course, within our office, it's all HIPAA compliant. So we were able to, it was not an issue for us. I mean, we are, I could say, and we have all the software HIPAA requirements. I would almost say the most difficult is leaving paper out, not HIPAA, but we do talk about it regularly, and we are approved by the state.
Great, thank you. That's an interesting model.
All right. So I think we will take a quick break and then come back with a couple more presentations. We'll start with Flint MTA from Flint, Michigan, and then we'll go to the ASU Cloud Innovation Center after that. But we'll take 10 minutes. So it's getting the math wrong all the time today, but it is in your time, it is 10:55, right? Yes. Okay. So it's 10:55 in Arizona. So we'll be back at 11:05. And thank you, Stephanie, Barb, and Gail and Sagan, and then Stephanie to Marilyn as well. And thanks for your time and for all the great work that you do. And then, well, you'll certainly hear from me soon too. All right, cool. All right, see you all in 10 minutes. Okay, welcome back, folks. And so we're excited to keep talking about lots of cool stuff happening. So I am going to hand it over to Tracy Davis and her team at the Flint Mass Transit Authority in Flint, Michigan. So Tracy, it is all yours and Andrew's and oh, there's someone else, but I can't find their name. I'll hand it off to you all.
Thank you, and good morning to some of you and good afternoon to the others of you. Thank you for having us to present what we do in our services. We are the MTA Flint Transportation Authority. I'll be discussing with you along with my team, Lori Lavery, Andrew Lang, and Misty Graves. We're just going to share about what we do primarily in our department. But I just wanted to share with you that MTA has been in existence for over 50 years. And what consists of our transportation services is our primary route services, our regional services, our paratransit services, as well as our on-demand services. And that's what we're going to talk to you about today, is the Rise to Wellness on-demand services. And with that said, I'm going to give it over to our mobility navigator, Lori Lavery. Lori?
Andrew, if you could put up the next slide. Good, Lori?
Are you there, Lori? Okay, I'll go ahead and start us off. I don't know if she's having any technical issues, but just as you can see, in the Rise to Wellness Service Department, our department started out in 2016 through our water crisis, where I know that many of you are familiar with that occurred in 2015 in Flint, Michigan. And with that water crisis, we were birthed out with a partnership with Michigan Department of Health and Human Services. And with that partnership, we were able to use services or allow our clients to utilize the service that were Genesee County clients. And it started out just with the whole Genesee County department, and it narrowed down to just the Flint residents. But the partnership just didn't start there. It expanded out to more of the health and wellness transportation that we now provide. And that service we provide is we do transport in this department, health and wellness only, which is in the medical transportation. We take our clients to the grocery stores as well as the pharmacy. So again, this particular department in Rise to Wellness only gears to our health and wellness clients. Lori, are you there? Okay, Andrew, if you can move on to the next page. As you can see, and I think you've heard this before with others that presented today, there's approximately about 3 million Americans that miss or their medical appointments are delayed due to the lack of transportation. And so we were just ecstatic that we were in a position where we could provide the transportation for our clients. And again, that was the whole goal for our department, is to cater to those that have medical needs if they need to go get their pharmacy or their medication, or even go to the grocery stores. We know that here in Flint, if you are not aware of Flint, Michigan, we not only had water crisis, but we also had many stores that shut down, grocery stores. So that created another barrier for our residents here. So we wanted to make sure that those clients had the opportunity to be transported to get their grocery needs as well. Andrew, if you can go to the next page. So before I go any further, Lori, are you there? Okay, in this process, what we've learned is that as we were connected with Michigan Department of Health and Human Services, we know that many of their clients were Medicaid clients, the Medicare clients, and the way that we were able to partner with MDHHS is that their clients had to have an active case number, which would allow them to utilize our service. So again, many of these clients, they had Medicaid and Medicare as well. So we were able to provide those services for them. Now with the services, because of the high volume of clients that we were beginning to have, and I think we started out with about 30 clients in the first month of us starting, and we knew that it was going extremely fast, so that we had to put like a limit on how many trips those clients could be transported. And just so you know that when we did have a partnership with DHHS, it was grant funded. It was grant funded through Department of Human Services, so it allowed us to be able to transport without having any concerns about how the client was going to pay. And I think in the first year, it was like $100,000 to start with. And so we were very delighted in that. If you can move on to the next page. All right.
Oh, are you good? So as Tracy's already talked about a bit, our program, the Rides to Wellness, we figured it was determined that that would be the best solution to develop this program, a health and wellness initiative that combines the best of public transportation with the convenience and personalization of ride-hailing services like Uber and Lyft, but at that low cost rate that we can provide. Next slide. So what does our program entail? The MTA Rides to Wellness program includes same-day service. We offer 30-minute wait times for pickups, same day. We offer door-through-door service for customers needing special care. For the most part, we provide door-to-door, but we do give that door-through-door as well. We offer connected trips, so we'll stop at the pharmacy after the doctor's appointment, or maybe even the grocery store and then to the pharmacy. We're very flexible in what we offer to our clients. We have dedicated trained staff and drivers to provide excellent quality transportation. We have a variety of passenger vehicles, wheelchair capable and otherwise. So that's been a key feature of our success, is having a lot of different vehicles to offer clients, whether it's a smaller car like an Impala that's low to the ground and easier for a lot of people to get in, or if they need that lift to get them up into the vehicle. It's just key to have a lot of different options. We also provide car seats for families, not just mom and dad, but even grandpa and grandma. Maybe they're watching the kids and they need to get out to the doctor's appointment or to the store. So I think that's all been another large part of our success, is offering that kind of device to them. And lastly, we just wanted to highlight the key principles of our program, which have led to our success, is being adaptable, being flexible, and those aren't the same thing. Being adaptable means we're making big changes permanently over time, and flexible where we're able to make small changes on a day-to-day basis, but return back to our norm. And just being able to meet the needs of the community at large. That's always our goal. Whatever we're doing, we're adapting and flexing to meet the needs of everyone. Next slide, please. All right, I'll turn it over to you, Tracy.
So with the partnerships, as you can see, as we stated before, some of our partnerships started off with Department of Health and Human Services. And as we stated before, we do medical medical trips. Not only with those medical trips, we also have partnerships with the hospitals. One to name is McLaren Hospital here. And the type of service that we provide for them comes from different components of that hospital, ranging anywhere from emergency room discharge. We do different components of the cardio department that they have. Just many arrays of types of services that we provide for that particular hospital alone. Right now, we are also targeting senior living facilities to see if they will be interested in doing partnerships with us as well. If you could turn the next page, we'll be able to show you the different partnerships that we have. And currently, we have about 24 partners ranging from Department of Health and Human Services, McLaren Hospital. We have a partnership with the Veterans Services of Genesee County. And that partnership came much later down the line, and it has been greatly successful. We transport dialysis, for the dialysis units. We not necessarily have a partnership with them, but we do transport their clients. Here you see the My Children's Health Center, Michigan Vascular. We also have different agencies that we partner with that also transit agencies that they have asked us to help with transportation as well. Next slide, please.
All right. And so another key part to our success here at Rides to Wellness have been the innovative technology that we've been using. The program we use is called Transtuitive. It's an all-in-one fleet management tool, has automated scheduling with a lot of intelligent features and filters for that automated scheduling. We schedule probably over 90% of our rides, which is 300 to 500 trips a day, are auto scheduled, meaning minimal interaction with our staff. Another key feature of Transtuitive is the live map, which allows us to see our fleet in real time. And we can access that, see where any vehicle is at on the map, and what we can get from them. We also have tablets, or MDCs, as some transportation units might call them. So that we have apps on the tablets that give the drivers their manifest and allow them to see everything that we need them to do for the day. They're able to receive updates automatically over data through the app. There's a lot more it can do, but those are the key points. They also get GPS navigation. We use Google Maps for that. That helps them tremendously, so that not every driver has to know the area, know the road. We have mobile payment processing on our tablets, so that's allowed us to be open to the public. We don't just have to work with agencies. We can also work with the general public and allow them to use our services by paying for the rides at the time of the ride when we pick them up. Another huge feature that's probably the largest point to our success has been the partner portals. We've already heard a few other transportation agencies here mentioned portals, and it's a very similar concept. We have a self-service tool for agencies to book and manage their own client trips. So we've reached out to over half of our current partnerships are using our portals, and they're able to book their trips for their own clients and manage just about everything they should need to do on their own. And lastly, we wanted to mention the passenger portal that we have through Transtuitive. That hasn't been as big of a success. It's a similar concept where they would be able to go online or go on an app, and we didn't have much success in deploying that. A lot of people didn't have the resources, a phone, a computer at home to use that, or just weary of using that kind of technology. Most people prefer to just call over the phone. It is still something we're looking into to try and encourage more deployment of that, but we didn't have too much success with the passenger portion of that. I think we're good on that. Next slide, please.
Yes, and I would like to add, there was a question on in the chat, and the question is, our billing functions with partners also available with the partners. And yes, there is. In some instances, with the partner portals, it is designed where they can not only book trips and check on the rides, but there's a function in or feature in there that allows the partners to see how many trips they've done a day, a week, or month. And it also shows, it has like a report and an invoice that gives you like the total. Along with that, we have our mobility navigators that will take those numbers and report it not only to the agency, but our billing department. And from that point, they connect with the partners to make that collection. That was a good question. Thank you. Now, where we are now, before I go any further, I did want to add to what Andrew was saying about the passenger portal as well. And he stated that there was a struggle with us getting that off the ground, and that is correct. A lot of it did have a lot to do with seniors. A lot of seniors, as you well know, some of them are not computer savvy. And so just as he stated, they prefer to call off the phone and talk with a coordinator. But we have not given up. We are still pushing the passenger portal. That has been a few years ago when we pushed it. We'll be working on pushing that in the near future. But we believe at this point, a lot of seniors are being educated. They're using their Android phones or their iPhones to get more acclimated in how to use computers. And as he also stated, there are some people that just did not have access. They did not have phones, or they did not have access to online as they do now. So we will be pushing that out a little bit further in starting this year. Now, where we are now, basically starting in 2016, we started off with one mobility navigator. We started off with 5 drivers and 3 vehicles. And that was quite a challenge, being able to utilize 3 vehicles and do the service with 5 drivers, but we made it happen. In the first month, we were very excited and shocked that we did 169 trips. But since then, moving to 2021, we expanded our services. So along with the expansion of more trips, we had to have more staff. So with that, in 2021, we ended up with 4 mobility navigators, 8 coordinators. We expanded to 130 drivers, as well as 72 vehicles. And at that point, we had accumulated 16 partners. And as you can see on the slide, and we were over 66,000 trips in that year. And since then, we've expanded into 2022. We now have 6 mobility navigators, 16 coordinators, 125 drivers, as well as 111 vehicles. And as we stated before, we have 24 community partners, and almost at 150,000 trips in the year of 2022. So the services is increasingly growing, and it's some of the barriers that we even have now is keeping up with drivers, making sure we have enough vehicles and enough drivers to be able to push the service. Right now, we're able to maintain without any hard pressure on the service, but we recognize that this is not going to slow down anytime soon, and hopefully we will not have any more issues such as we did in 2020 with the COVID situation. So we are pretty much on the rise at this point, and we look forward to having more partners as we go along. I know that we've ranged anywhere from 11,000 trips to 13,000 trips a month. And we're just excited about the growth. If you can go to the next slide. Here it stays here moving forward, and I've already expounded on it. If our goal is to gain more partnerships, and we're looking at more hospitals to be in partnership with, as well as other doctors' offices possibly, as well as some of our senior communities as well. We understand that people are living much longer, and so although they're living longer, but the transportation barrier is there as well. So we are preparing ourselves for the uptick that we are expecting to take place in the next few years. And that's all we have. And thank you again for having us.
All right. Thank you all. And so while I transition to our last set of slides, I'm gonna let someone in. While I transition to the last set of slides, Lindsay had mentioned that they also, as part of a large healthcare team, they get burned out on the different apps that they have to interact with. And so that's definitely a key point to really keep in mind for a lot of folks. Then also Hezekiah asked, what strategies do you have planned to overcome some of your technology barriers?
Well, as you can see, most of our services is conducive partnerships. And with those partnerships, we're just doing more training with them to get them familiar with being able to book the trips for their clients. As far as training the public, we will look into offering training. We understand that there are some barriers for seniors, and there are some that are not seniors that have barriers as well. So we'll be open to doing training to the public as well.
And Dee Dee has her hand raised. Go ahead, Dee Dee.
Hi, thank you, Tracy. Great presentation. I just have a question. I know dialysis are one of the most hardest trips to fulfill, and I'm really impressed of your work with DaVita. Could you tell me exactly what your partnership is with DaVita?
Yes, we have one of our mobility navigators is on this presentation, and her name is Misty Graves. She has been dealing with the partnership for dialysis for over 20 years. And so she can expound on how that started and where they are today, and any other questions that she has. She's the expert at it. Misty?
She wants me to speak about how did we start our partnership with DaVita?
I think basically before we became under the umbrella of Rides to Wellness, it used to be all about it being public transportation, and people were looking for the most cost-effective way to get to the dialysis centers. And as dialysis grew, they had more and more people that were utilizing Your Ride, which is MTA's.
More open to the public.
More open to the public. Okay. And it just got out of hand after a while. So what they did was they started calling us directly to make sure that everything, the times, the dates, were set up so that there weren't any confusion. You know, we deal a lot with elderly people that are on dialysis, and they would get their days wrong. They would get the unit that they were supposed to be dialyzing at wrong. So it's just much more efficient now that we talk directly to the dialysis units.
We require the clients. Right?
We require the clients to
Well, the clinics have
the
to speak with
clinics
us
to
directly.
supply us with the information so that there's less confusion.
So if a client contacts us and says, well, really wants to change or update any information about their trip, they actually have to go back to the clinic. That way we're keeping it all centralized
That's
and
correct.
we're hearing the correct information from the clinics.
Right.
Yep.
Yeah, and even to piggyback off of Misty and Andrew, as I stated earlier, we transport DaVita and Fresenius clients, and it is a partnership, but not a partnership where DaVita and Fresenius are paying for their clients, but it's a partnership in a way that we are the liaison between the two, between dialysis and the client, to ensure that there's no confusion about how the trips are being booked. As Misty said, a lot of the clients are elderly, and many of them were so sick that they just were not oriented enough to understand what needed to take place to get their transportation in a way that they could get there on time and being able to be transported there and back. So that's how that partnership became, so that it would be just an easy transition for that client without any any issues on their or hardship on their end.
Right. The dialysis units are not coming to us. The people are actually going to them and saying, I want to use Rides to Wellness. And at that point, the dialysis units will reach out to us.
That is correct. And what Todd, just to piggyback off of what Todd is saying, what he said was, even without the financial partnership, simply having a communication partnership with dialysis is huge. And it is. My heart would always go out to Misty, because for a very long time, she did this by herself. And she, again, did it over 20 years. And now, because she's in a new role, it allowed her to be able to train more people to be the extra voice and extra hands to be able to help DaVita and Fresenius in getting those trips booked without any issues. So that is correct. It is huge. And we've come a very long way. It is going quite well. But even with that, there are still some barriers. We have issues with and some of it is communications, but we're all human, things do happen. Oftentimes, we run into clients that are not feeling well. They end up going to the emergency room, staying in the hospital overnight. And so some of those communication barriers tend to fall through the cracks. But again, that is something that we're forever working on with the dialysis units. And to add to that, we are still doing a lot of the transactions through, we've been doing it through email, but we are getting to a point where we're going to transition the dialysis units through the partner portal. That way it would allow them to book the trips themselves without having to email us and call us. They can do it themselves. So that we'll be working on that very soon.
Thank you.
All right, thank you all. And so we'll have more chance for questions after this next presentation. So if you have any questions, feel free to put them in the chat still, or we'll open it up shortly. But in the meantime, we have Jubileen Vilku from ASU's Cloud Innovation Center. And then Jubileen, I saw there you are. Great. So I will hand it over to you.
Perfect. Thank you, guys. As Andrew mentioned, I'm Jubileen. I am a Senior Program Manager with the Cloud Innovation Center. And I'm going to be talking today about a project that the Cloud Innovation Center did with Maricopa Association of Governments called Potluck. Andrew, if you can navigate to the other slides. Before I get into the details of our project, I'd like to give you a background of what the Cloud Innovation Center is, what our goals and missions are. I'll go into some detail about our project, and then chat about the solution that we built, and wrap up with a current status of the project. Next slide, please. So the Cloud Innovation Center is actually a partnership between Amazon Web Services and a higher education institution. In this case, it's Arizona State University, but the Cloud Innovation Centers has facilities all around the world, 12 institutions. And our goal is basically to drive digital innovation in our community. And what that means is that we'll partner with state and local governments, we'll partner with nonprofits, work backwards from their core problems using Amazon's working backwards process, and then build a solution prototype completely complementary with our student interns to lower that barrier for innovation. Sometimes governments don't have the resources or financial flexibility to try new innovative technology to solve problems. So we help allow them a chance to try to do some innovative projects. And then at the end of our engagement, we publish our solution on our website and share it with our customers. And if they feel like this will really solve their problem and want a pathway to production, we'll connect them to partners or provide them with resources that helps them get to that next level. The goal of our program is just to create solutions that are replicable and scalable, because we believe that, you know, if there's a challenge that we've solved in one field, I'm sure there's going to be other organizations, other governments all around the world, around the country, who have similar issues as well. So we try to make a difference in the community by running this program. Andrew, if you can switch to the next slide, please. Some of the projects that we worked with and some of the customers that we've worked with, especially in the Phoenix metro area, is like City of Phoenix, the City of Scottsdale, City of Tempe, the Human Services Campus, the Maricopa Association of Governments. One project that I'll be talking about today is with Maricopa Association of Governments, so I'll get into that a little bit more, but the type of work that we do varies from water conservation to graffiti abatement to transportation reporting. Anything really in the smart city space is something that we support. Next slide, please. This particular potluck project is related to improving communication between transit providers, healthcare organizations, and the patients. I think I heard Misty and Andrew talking about, you know, older adults who have medical transportation needs, and sometimes they can be confused about timing. Sometimes hospitals cancel appointments at the last minutes, and there might be confusion about the dates in terms of the patients, and the patients end up traveling long distances. Especially in rural Arizona, you might end up traveling 2 hours to 3 hours to get to a medical facility and only to find out that the appointment is canceled. So when we were looking at this particular challenge, we were trying to solve, how do we make this process a lot more efficient? Next slide, please, Andrew. Thank you. Like, how can we seamlessly allow communication between these three different stakeholders, the transit providers, the healthcare providers, and the patients? And the way that we approached it was that we would create an application that would allow notification to transit providers whenever an appointment is canceled or rescheduled. And if we create this in a way that there's low barrier for the stakeholders to utilize, then all the key stakeholders are informed when something is changed, and that reduces those miscommunication that led to those erroneous trips. I know that traveling in rural Arizona, if I'm traveling back and forth, it takes a long time and it can be really, really frustrating. And it can really, it can really leave a very bad taste for the people who really need this service. So if there is a way that we can make this process efficient, that was our goals. In terms of the process flow, Andrew, if you can hit the next slide. It's pretty straightforward. We have an app for transit agencies, and then we have an app for the healthcare providers. The transit agency goes in and creates, enters the information of the customer and generates a link related to one customer and transit agency. They can pass that link to the healthcare provider, who can then pin that in their ERM system. Think about it like those lovely emails we get for subscribing, non-subscribing to junk mail. When you click on it, it takes you to a page. You just have 2 buttons, and that's the end of the flow. This link would be something like that. A healthcare provider, if they have to cancel or reschedule an appointment, will just click on the link, and you can navigate to it, and then enter the appointment that you're canceling. And once you submit it, it would send a notification back to the transit agency, who now have an email, or we could do text message, whatever. Now they have a record of a change in this appointment, and that way you can reduce those erroneous trips. Andrew, if you can swing to the next slide. I have some screenshots of our the app that our students built. This is the transportation providers page. They'll log in. Next slide, please, Andrew. You can enter the patient information, first name, middle name, last name. You can put in a couple more attributes here. And then if you hit generate, Andrew, next slide, it will generate a simple link that they can email to the healthcare providers, or send a note to them themselves. When you click on that link, you would navigate to this particular page, which will have the information about the patient and just their name, nothing that is more detailed than that. You can enter in the appointment details, click submit. Enter next slide, please. Choose whether you want to cancel or reschedule the appointment. That can add more information. If you choose to reschedule, you can choose whether it's a virtual visit that you're rescheduling to, entering the date and time of the appointment, and then hit submit. Once you hit submit, that's just going to send an email notification to the transit provider, and they will now know that some change has been made. The idea was that, it's relatively simple for anybody to use. It doesn't require a high level of technical proficiency, and it solves that communication gap issue that seems to be an issue regardless in which industry that you're working with. I think we heard our previous speakers talk about that challenge as well. Behind the scenes, it's a little bit more complex. We have about 8 AWS services that we're running behind the scenes to do authentication, to run the code for the events that generate the emails. We have database to store basic information about the single page application, and just to support the whole process flow. So overall, we have been working on this particular prototype. As I mentioned, the Cloud Innovation Center isn't a production shop. We allow for people to experiment solutions based on certain use cases. So our prototype development is completed. We are working with Maricopa Association of Government, Verde Valley Caregivers, Northern Arizona Healthcare to see a mechanism to test out this prototype, to see whether this is actually going to make a difference in the lives of these patients, older Arizonians who are encountering this issue. And then Maricopa Association of Governments is also exploring partners that can help scale this prototype into a production solution. So this was a lot of information, but if you want to know more about our project or any of the other projects that the Cloud Innovation Center has worked on, or if you just want to contact us, you can navigate to smartchallenges.asu.edu or contact either me or Ryan, and you can learn more about us. Thank you very much, guys. If you have any questions, please let me know.
All right, thank you. All right, so I think with that, we'll open it up again for Q&A, but for everyone that's here. So, so who would like to go first?
Andrew, if I can just jump in with a quick comment, just want to thank Jubileen and Arun and all the students. Being able to work with them has been really, really helpful because they've been working with us really for almost a year now to really untangle what are the biggest needs and what's the best solution in order to meet those needs. So if others would like to work with the Cloud Innovation Center, I would encourage you to reach out to them. They're a great resource in our community.
Hi, I like to follow up on that comment also. And I like to follow up on Lindsay's comment that, you know, saying it's wild, seeing how non-governmental entities can accomplish. I definitely was amazed with the work and how fast working with ASU and the Cloud Innovation Group was able to kind of look at what are barriers and take an outside look and from a totally different perspective and ask the right questions that sometimes we overlook because we're in the middle of trying to accomplish something and trying to push something forward that we know what the challenges we think we know and then what kind of would be the solutions, but having another group and another perspective to take a look at that and ask those questions that, you know, probably we even overlook. So yes, it's a great opportunity. I definitely would encourage anybody to reach out. You know, if you want more details about our potluck, definitely reach out. And it has Tracy and Misty and Andrew has stated that, you know, their partnership with the dialysis was kind of that middleman, and it was organic because it was a need. So this is trying to get kind of cross that barrier of that communication. And a lot of times, you know, we kind of overlook that sometimes. So like, you know, we need transportation services and this is how we're going to get there, and not really looking and dissecting what is that need and that communication and how to provide that. So thank you so much. Great project.
And we do have partners for the demonstration phase of this, but we will be rolling out a pilot project phase as well. And we are looking for partners. So if you're a transportation provider, particularly on the nonprofit side, if you're a healthcare provider, please let us know. We'd love to be able to work with you and really further test this out and then be able to refine it before it goes into full-scale launch and production. So if you'd like more information on that, I'll put my email address in the chat, and please do feel free to reach out.
I did like your comment. And that's exactly who I was thinking of when Misty and Andrew and Tracy were doing the presentation. And then when Jubileen, I did see a little bit of similar challenges. And, you know, and I am curious too to see if maybe there could be some kind of coordinated effort.
Sure, and yeah, I didn't want to put the team from Flint on the spot, but I'm curious if they're still on the line. Yeah, two kind of, it seems like that there's a lot of similarities there. And it seems like you guys maybe have kind of, or you know, a couple years or a couple phases ahead, but kind of in terms of what that initial piece is, that communication function is a tremendous challenge. And I'm just curious if you guys had any feedback or lessons or learned lessons or recommendations or advice. So.
Yeah, Todd, thank you. I do apologize. I had a double meeting and I literally just stepped away and jumped on that call and it just ended. So I missed what Amy mentioned. I do apologize for that. Can you share what challenges you have?
Jubileen, do you want me to take that or do you want to provide that?
Yeah, go ahead.
Okay, great. So one of the challenges that we're seeing is about 17% of appointments end up being canceled and the patient isn't able to or hasn't received the information to be able to track that well. And so about 17% of the time when you have typically a nonprofit volunteer driving an older adult to a medical appointment, they show up and 17% of the time that appointment has been canceled. So that's a burden on the transportation provider because that's a ride that could have gone to somebody else that was probably needed and not fulfilled. It's a burden on the older adult because then they've just wasted time, and particularly in rural areas are often traveling long distances to get to an appointment. And then it's a problem for the medical care provider as well, because then they have missed appointments and that could result in incurred costs by them, as well as, of course, a person's health declining because they aren't receiving the appropriate care at the appropriate time. So we've been working to streamline and improve the communication flow between the nonprofit transportation provider and the medical care provider. And so we've developed this platform as a result, but it seems like your work could help to inform what we're trying to do here as well.
Yes, we do experience the cancellation issue as well. One of the things that helps us a little bit is because we're on demand, and it's a non-share ride with a client can book a trip and be picked up in the next 30 minutes. So being able to operate in that capacity, it kind of, if there's any cancellations, there's always that availability open for the next person that does need that trip, and it works out in that way a lot of the times. However, dealing with those that are our regulars, I would say, that cancel on a regular basis, we just simply implement our no-show policy. And when we implement that, it kind of slows things down from what, it lets them know, okay, if I cancel again, I'm going to be suspended from the service a few times.
Sorry, no, it's more so that the medical care provider has changed the appointment, and they let and they may or may not have let the patient even know. So it's not necessarily the older adult who's canceling the appointment. It's the older adult showing up to an appointment that's been canceled, and for whatever reason, they didn't know. So for example, we have some healthcare providers that have a standard policy of sending text messages with updates about a person's appointment. Well, sometimes they're sending text messages to a landline because that's all that the older adult has, or the older adult doesn't have a smartphone, or they don't know how to use the smartphone in the way of being able to send and receive text messages. So the focus isn't on the older adult and holding them accountable. The focus is on improving the communication between the healthcare provider and the transportation provider, so then the transportation provider can coordinate better with the older adult who's receiving those services.
Yes, I don't see that we have that is a huge issue. Now, as I stated with dialysis, that the issue is more with the dialysis department than any parts of the service that we operate in. And we are constantly communicating with them to say, hey, if you know that the client has any changes, if you know that they need to change their times, the dates, please communicate that with us. That's the only way we would know. We are due to have a meeting with all dialysis units very soon. And so that will be one of the highlights that we will discuss, because it's a major issue in that department, that part of our department. And Misty will probably be able to expound on that a little bit more, because she's hands-on with the dialysis unit. She is the mobility navigator that communicates with them more.
Great, thank you.
Misty.
Right, communication is just really key. One of the biggest obstacles we have is that, like, if somebody goes into the hospital and they come out, they may have gone in ambulatory, but they come out and they're using a wheelchair. Mm-hmm. And so if we're sending a car to pick them up and they now need a lift, mm-hmm. those are the obstacles that we come across quite a bit. And sometimes the dialysis centers don't even know that when they come out of the hospital, they're now going to be in a wheelchair or using a walker, or but that's our biggest obstacle.
Great, thank you.
So it's not much different from what you're going through. And I think just having a constant communications with those partners and just letting them know how crucial it is that they communicate that that there are changes or there is a cancellation. But until we can get them to understand how crucial it is, and we'll even explain to them, like, you have those changes and you have your client there dialysizing, they may need that day as well. And that client is missing that opportunity on that day when you could have let us know that there was a cancellation for that client to be able to go in and be dialysized there. So we will continue to push it. I wish I could share more with you on how we handle it, but that's not much more we can do, but constantly communicate the importance of, sharing the cancellations.
No, that's great. Thank you. And once we get the production ready version up and running, we'd be happy to share it with you, and maybe you can use it too. Excellent. And there's a chat that's been posted, not exactly on the topic, but I'm really curious about how well the new clinic services by Amazon will go.
Not sure if that's for me. Maybe we can clarify that message.
Lindsay, if you want to unmute. Oh, go ahead. Yes.
Sure. That was just a very, very general comment, just because I noticed this rollout by Amazon where they provide access to a clinical service. So for things like a UTI or a tooth infection or something, it looks like you can use a clinical service. And I realize that's not connected to what we're doing here, but it's just an interesting update in our lives as Americans, and I want to see if that's going to be a successful rollout.
Yeah, no, thank you, Lindsay. Great question. Jubileen, are you in a position to speak to that?
I'm not, but we can certainly get some more information and get it to you guys.
Great, thank you. Appreciate that. Right, so Lindsay, we've got your email address, so we can send some information out from Jubileen as soon as it's received. Thank you for that question. Todd?
Thanks, Amy. Yeah, I guess I'm curious. I do think that this is, again, maybe better set for this afternoon's kind of discussion. We're really wanting to jump into this, but I'm curious just from the participants here in kind of thinking about that challenge of what Jubileen's presentation was trying to overcome, that communication function with the hospitals. I think that is very much a product of some challenges that we've heard from a couple of providers, but I'm just curious from a kind of a broader group, is that a thing that's facing a challenge that's facing your agency? Because as I mentioned before, we really don't have room for these types of inefficiencies. And so I'm just curious, is that things that a similar challenge that you guys are facing? Use the chat or just pop in and let me know.
I can go again on this topic. I would say that's definitely a challenge, and not just between transportation and hospitals or transportation and care providers, but between transportation and all involved parties. So we provide transportation to SDOH. That's not just healthcare, it's also food access, it's getting documents at the DMV. So making sure that everyone's schedules are coordinated. Like maybe somebody has an appointment at 10 a.m., but the food box is only open from 9 to 11. So there are many, many different pieces of the puzzle that all have to be coordinated simultaneously. That's the challenge that I see.
That's a great point. Thank you. Definitely. Particularly when our resources are so limited, we really need to make sure that we're maximizing them as much as possible. And the scheduling is really key to that. I can see that.
Andrew Lang also added in the chat that people don't always know what options are available to them. Communication is just always a challenge.
I think it's interesting too to think about communication, particularly in terms of the digital divide. We're just seeing that grow wider and wider and deeper. And that's really concerning because there's a portion of the population that feels very comfortable and may often even prefer communicating by like text message or by some other digital means. And then you still have a portion of the population that just doesn't do that, and so I think it's a challenge to try and bring those two together, because often people on one side are trying to help people on the other side, and there's this divide between them. And so trying to overcome that, I think, is a real challenge across the board.
And I think the next phase of this challenge, and the next phase of this project, the potluck project, definitely we are looking for agencies to see, and definitely if this is something of interest to you, we would definitely reach out to us. We want to make sure that this is something that we're working on, that all agencies are able to take advantage of, and which kind of goes back to the Embark presentation when we're talking about technology. I like how she was talking about in her presentation that she's working with agencies at different levels of technology, and it's not just software that she's working at, that people have has scheduling software, but she's also working with people with the lower end technology of pencil and paper, and they're working with where the systems are at now, and that's exactly what we're looking for with our potluck. How will this work with the agency at the level that you are at? And I just lost my train of thought. I just wanted to encourage everybody, because we do want this to be able to fit the need of agencies, and that's why we've worked so hard on this. But definitely the next phase of this pilot project is that communication. When I first started, we did focus groups, and we went out to different focus groups, and then we wanted to come back to them to tell them the outcome of the focus groups, and we asked, what is the best way to communicate with you? And a lot of people said, call us. And then and so, we said, the majority of the people said, call us. So the question that we asked was, okay, if I call you and you don't recognize my phone number, will you pick up? And then a lot of people were saying, no, they won't, because we were working with older adults. But definitely communication, as Andrew had noted, is a lot of people don't know the options, so we would like to look at also that phase of what is the best way to communicate to the consumers that of all these options that we have that would benefit them. That was the point I wanted to make. Thanks.
We have a chat here from Lindsay. I'm just scrolling up to read it. Oh, and there's two. I would love to better engage the travel trainers we have in the state, even though there are not many. Lindsay Bell is really great at training her clients how to access vital services, even outside of transportation. Lindsay, feel free to unmute if you'd like to elaborate on that.
Sure. And I promise it has nothing to do with her name. But yes, we do, or at least ADOT through mobility management funds does have some travel trainers throughout the state whose job it is to simply teach people how to ride on a public transportation system, if there is one, how to access client-based transportation systems. And then during the pandemic, it changed to how do you get your prescriptions when you can't physically get there? And how to better utilize technology to improve their lives and reduce some limitations. So I just feel like this is a perfect opportunity to start engaging folks like Lindsay Bell, because I think they have a lot of experience, what I call on the ground bureaucrats who know what's going on.
Great, thank you, Lindsay. And then Linda mentioned in the chat as well, coming from a small nonprofit in a small community with the local hospital not having this type of communication system, they leave it up to the patient who they are using for their transportation. We as a transportation program have to rely on communication between rider and our program, which I think is something that I can bring up at one of the meetings that I am invited to with the regional healthcare facility in our area, which is located on the reservation. So Linda, if you'd like to add to that, you're welcome to do so.
Yes, good afternoon. Thank you. I do, as the program administrator for a small nonprofit, we are located, of course, on the reservation. A system like this, I think, would help tremendously because there's so many different types of transportation in our area. And I believe there were years ago, we tried to do something of this nature, but I don't think it came to fruition. But having a communication system, especially the hospital, there are several people that do need rides. Some do not have rides home after their appointments or after their discharge. And if the hospital knew, I mean, if I could talk to, because I'm invited to their quarterly meetings, because I do provide service to seniors, so they want to hear from different areas in our community. So that's how I come to attend those meetings. And I think this is something that I will bring up because it is, like I said, an issue in our small community.
Linda, that would be awesome. And if there's anything that we can do to support and engage in that conversation with you, that would be fantastic. And we'd love to be able to see if there might be opportunities for us to work together.
Thank you.
Thanks.
All right. Is there anyone else who had some thoughts that they wanted to share or questions related to our 5 presenters from this morning? We have a little bit of time left before we break for lunch. So now would be the time. And then this afternoon, we're going to open it up to a more facilitated discussion, kind of carrying on from where we are now. And we have some prompt questions for that. But in particular, there's one that we wanted to start off with before lunch for the next 5 or 10 minutes or so, while this is fresh on our minds. So is there any, I know we've kind of been focusing more on the challenges, which is a natural place to go. But first, are there any highlights from this morning that you want to explore, things that came to, brought to your attention that you thought, hey, this is really cool, I want to explore this? What are some of those that you would like to raise? Now would be the time. We'll start off this afternoon after lunch with this as well, but while it's fresh, before we take a break, what are some of those highlights? And you're welcome to just jump in, unmute yourself. That would be wonderful. You could raise your hand or also chat and I'll try to raise it. Tracy, raise your hand.
Yeah, we mentioned with Rise to Wellness that most of our services through partnerships, and we have found that through those partnerships, that's where it's just been very, very successful. And so with that said, my encouragement to each of you, if you can make a partnership happen with your agency, push that, especially with the hospitals. Remember I said earlier, the hospitals, there's so many different departments within the hospital alone. You can meet a lot of the needs within, especially with those discharges. The hospitals are in great need to try to get their clients home from after being in the hospital. So that, and partnering with your DHHS and seeing if you could partner with your veteran services as well, because our veteran services is highly successful. A lot of people didn't think that was going to work out, but it did. And our mobility navigator, Lori, she is on there and she can expound on that as well if anybody having questions.
Thank you, Tracy. Those are great. We're taking notes to kind of populate a board that we'll show you this afternoon. But what are some other quick highlights that people thought about through this morning? Thought I saw somebody maybe raise their hand.
I actually did want to follow up on a point that I think it was Tracy who brought this up earlier, that your service is on demand and that has helped with cancellation rates. I want to just jump in and say I've seen this as well. Our company Elaine used to be booked about 3 weeks out, and we were seeing some high cancellation rates. We have since moved towards a model that is a much shorter booking time period. People are not allowed to book more than a week out at this point. And we've seen that has helped a lot in our appointment adherence rates.
You're right on point with making that change, because that was how we started. Because it's on demand, we operate just like Uber and Lyft. You can book a trip that day, or you the further out you can go is the day before in 24 hours, no more than that, because we know that people forget. They book the trip and they forget to cancel. So we learned that very early on, so that does help out with that. And two, it also puts us in a position where when we started our service, we already knew that we did not want to deny any rides, and we don't. If there's any challenges, we ask the client if they would like to change the time, at a later time or earlier time, and that helps too. So it's been very successful doing it that way.
If I may, this is Linda. There was a couple of things, Amy, on your age-friendly program. There was a couple of things you stated that was helping people to engage in social isolation, because we deal a lot with that here where we are located. So we've been working very hard since we reopened our center after COVID and getting ready for our seniors to come back. So we're, it's like starting all over again, but this is something that I would be more interested in. Also in the part where Stephanie and Marilyn, they had some information sharing. They shared some things on coordinating and partnership. Start small, and these are some of the things that really stuck with me. So I would like to hear some more about that. Thank you.
That's great. Thank you, Linda. And then Todd, actually we had one more. Local First Arizona was dropped in the chat. Mauricio, if you're there, would you like to share a little bit about that? If not, folks can pull it up on their own.
Yeah, good afternoon. They're a statewide organization. And one of the things that they're really into community development. They work with a lot of small businesses and non-for-profit organizations. And one of the things that I really like about them is that they find funding resources, but on top of that, they also pay for grant writers. And I know that's something that really it's a big hurdle for even like small organizations. When they're going after a grant, they usually have people that wear like 10 different hats write the grant. And it becomes very challenging. So I think one of the resources that they do provide is they do pay for professional grant writers. And these services are offered throughout the whole state of Arizona. So that's why I kind of wanted to put that information in the chat so people can know more about it, and it might be something that works for them as well.
That's great. Thank you so much for sharing. And then Todd, you put a couple comments in here. You want to elaborate on any of those or just quickly give the highlights? May have stepped away. I'd be happy to do so.
Sure. No, I just wanted to capture kind of my takeaways from the morning. And maybe there's a chance to introduce those this afternoon or have those as kind of leaping off points if we're struggling to find a new any other discussion items.
Okay, perfect. Yeah, we'll make sure we get those captured on the board. All right. Any other points that we'd like to raise before we break for nourishment?
Just one more reminder, through our work, I work for one of the Access Health plans in Arizona, Care First. And we have found that one of the most underutilized resources is actually faith-based groups. So I think it would be worth having a conversation depending on size of congregation. Usually faith-based groups within a congregation, they have a whole pool of volunteers And sometimes they don't know what to do with them other than maybe do food box distribution and things that the typical things that volunteers do at a church. But I think when there is a need, they will meet that need as long as there's like some type of training or maybe introduce new ideas to those volunteer groups that might be able to provide transportation or that might be able to be involved in some way. Just reaching out to that faith-based community, I think they're always willing to help as long as they have a little bit of guidance as far as what the program might look like or what the needs are. Just because we know that not one size fits all, it really depends on what area you live in and what resources you have around you. But we found that faith-based groups are always a good resource to tap into.
That's exactly what I was going to say, Mauricio. Our organization with AmeriCorps and AmeriCorps Seniors, we provide transportation directly through volunteers. So we don't have like any of the issues that everybody else has with cars or, having to maintain that data on that level. And so we've been reaching out to faith-based organizations, and it's actually been helping a lot because, as you said, they have the people that they see the need, and we just facilitate that need for them. So like we process their volunteers so that they get background checked and so that they themselves know that, okay, indeed, these people are, their background checked. And so they have that faith of knowing that they have quality people volunteering for them. And so that's where we step in to do all of that stuff. But it's been very interesting listening to all of the presentations and all the equipment that is available, all the programs that are available across, I guess, our nation, because we're talking with Oklahoma City. So yeah, it's been interesting. Thanks for saying that, Mauricio.
Thank you.
Yeah, thanks for adding to that. These are all great takeaways. And again, they're getting put on our board that we're going to show you this afternoon. But I think unless there's anyone else who wants to share, we will. Oh, Dee Dee.
I just have one thing. I like in Vitas where they have their staff trained in HIPAA. I really like to kind of explore that. I thought that was really interesting, and that they were approved by the state.
Great, that's great. We'll get that on there. Yeah, that's very important for these types of services. And Miriam added more information. Great, thank you, Miriam. So we'll break there for lunch. We'll come back. Let's come back a little earlier than what the schedule says, 1 o'clock, because will give us about almost 40 minutes break. We'll continue this conversation and we'll go from these highlights. You're welcome to add more to them, but we'll specifically talk more about what do you need to kind of narrow down the path to planning and implementation of such a service, including research, what funding might be out there, what partnerships you need, because we've heard a lot about this morning. Of course, partnerships and communication are really the fundamental to strong technology that we're looking to implement. But without that, tech likely won't get you anywhere. So there's more to narrow down here, but we're going to take a break, come back at 1 o'clock, and we'll pick up the conversation for the rest of the afternoon.
Just one final comment, Eric, is just kind of setting the stage for this afternoon. I do think that, we're really wanting to be hearing from you guys here in this hour after lunch where, I think that we're hoping to kind of provide an outlet here and some supports for some technical assistance to help kind of bring the vision for different solutions kind of to life or kind of apply some structure around them. I think that kind of through this, the team that we have here, I think that there's a lot of resources out there that, could kind of be cobbled together to actually look at implementing some of these items. And so I do think that's kind of definitely the point of emphasis for this afternoon is, to start coming up with concepts, areas that we'd like to explore and try to, look if there's kind of shared needs around those solutions and hopefully kind of develop some little mini coalitions to look to approach them. Again, to receive some in-depth technical assistance here through this larger summit. So hopefully you guys can be thinking about some concepts through lunch and really looking forward to the conversation afterwards.
Yes. Thank you, Todd. I appreciate that. So come back ready to chat, brainstorm. There's going to be no wrong answer to this. It's going to be fun. So we'll see you in, I guess, 40 minutes at 1 o'clock.
All right. And thank you everyone from Flint. And yeah, we will leave the room open, but I will pause the recording until we start again. All right. Enjoy your lunch, everyone.
Have a good lunch.
So for this afternoon's session, we teed it off before lunch that this is more participatory. The more that we have people kind of contributing, the more we're all going to get out of this. So our goal is to have folks, speak up. There's no wrong answers. This is more of a brainstorming discussion with some key prompt questions to kind of get us thinking about certain items that we're going to have to as we work to day 2 and then on to day 3. With that in mind, we'll start with an energizer, but before we do that, I just wanted to see if anybody, if others out there would be willing to turn on their video cameras, certainly optional, but it would help kind of lend to a more spirited type of discussion. So if you'd be willing to do that, that'd be wonderful. Also, feel free to just unmute yourself. We're going to try to make this to be informal. When the time is right and you want to contribute to the conversation, feel free to just do so and unmute. If you can't do that or can't find a time to interject, feel free to raise your hand. I will do my best to get you into the conversation, or chat in the chat box as well. And of course, if you've been following along, I'll also then ask you to follow up on what you've added to the chat. So we'll get you into the mix in a number of different ways. But to get us going here with an energizer, we didn't really do this at the outset because we had a lot to cover. But to get you all familiar with kind of the reaction button down at the bottom where you can raise your hand, you can click on that. And when I ask a question, if you want to say yes, instead of saying yes, indicate that it's an affirmative or a yes with a reaction. You can raise your hand like with the button, or you can do the thumbs up. You can do a laughing face, whatever you think fits your description. So I'm just going to do this on 3 things. If you live in the south of Arizona, please click, cheeseburger. There you go. You can indicate that you live in Southern Arizona, whatever you define as Southern Arizona, by adding a reaction to the group. So please go ahead and give that a shot. You can just thumbs up or a little ta-da. Give us a sense of where you're living. All right, so we got a couple. Thank you, Sam. Thank you, Miriam. All right, cool. And I think they'll go away automatically. If not, I think, they time out, I believe. So, all right, so we have a couple folks. If you've seen something pop up on your screen, that means those are your neighbors in Southern Arizona. If you live in Central Arizona, go ahead and do the same. Click on one of those reactions so we can see it kind of jump up on the screen. All right, Lindsay Post, cool. Got Hezekiah, Didi. Cool, all right. Thank you all. And you probably know where I'm going with this. If you live in Northern Arizona, click a reaction. Let's see. Cool. Carrie, Todd, Mitch. Oh, we got some more movement on this one. Awesome. Thank you all. Cool. Thanks for playing along. That worked better than I thought. So now that we've kind of got the blood flowing, some participation. Again, if you just joined us and you missed the beginning, we're asking you if you're willing to turn on your camera. Severe Northern Arizona. All right, cool. Someone chimed in the chat. We'll ask you to allow yourself to be visible, but of course that's optional. So Andrew, do you mind also showing the Miro board as we walk through? So we have this little board running where Andrew is helping us add things to each of these prompt questions, these prompt bubbles. These are obviously taking the shape of sticky notes, so you can visualize it as if we're in a room, writing things down, sticking on the wall. So as you add to the discussion, Andrew will also be kind of capturing this on a sticky note in real time. Something that we could refer to later. We can kind of lump things together in themes, and we'll take this to our session on day 2 when we're in person to further flush out some of these ideas. So hopefully that's fairly explanatory. We're not going to give you access to this board yet, just because of logistics. So if you want to add to it, which you should be adding to it through your conversations, we will take it and transcribe it to the board. So jumping back into where we were before lunch, I want to elaborate or kind of dive back into the highlights that you'd like to explore. We had some really good ones, some good conversations, people added to the chat. Are there anything else that you'd like to either bring up to the group again? Yes, Dee Dee, this is the exciting part. Or things that you've thought of after having your lunch. What do you think about the highlights from this morning's session?
Hi, this is Mauricio. Something that came to mind after we went to lunch is, I know that we're focused on transportation, which is great. But I think we also have to expand a little bit, because if you guys have heard that term, social determinants of health, transportation is always in the top 3, along with housing and food insecurity. So when we look for funding opportunities or we look for partnership opportunities, just remember that transportation is a social determinant of health, and they may bring additional opportunities for funding, partnerships, etc.
Actually, may I put something I heard out to the group really quickly? I recently heard something about Z codes, I believe under Medicaid, that there may be in a year or two opportunities for Medicaid funding specifically for SDOH, not just for medical transport, but for transportation that affects people's outcomes due to food access or other, SDOH. Has anyone else heard about this? I literally only heard about this a week ago.
You said Z codes?
That's the term I've heard. No, we don't even bill Medicaid at all right now. So this is not my area of expertise by any measure. I'm just curious if anyone has heard about this, because that would make it more worthwhile for us to get involved with Medicaid.
Yeah, Sam, you are correct. We're not there yet. We're just having initial conversations. And basically Z codes they're billing codes that are attached to the social determinants of health. I'm going to look on the Access website and put the link in the chat so you guys can have a better understanding of what that is. It has to do with employment. It has to do with transportation. It has to do with all of those things that affect our health outside of the doctor's office that are barriers to most people accessing their healthcare. So I'll put that in the chat for you. And you are correct. There's Access is currently encouraging all of the Access health plans to start having conversations with healthcare providers to start being more familiar in the use of Z codes, because down the road, there will be an opportunity to bill for those. But, we're probably a couple of years away, like you mentioned.
Right, if I can jump in on that point, great idea to bring up the Z codes. I think that's really important. So as we've looked at other initiatives, so for example, the Vilas Health Foundation had a great community paramedicine program, and they're able to work with the fire departments and other first responders to be able to be reimbursed. And it was all around getting set up with those Z codes appropriately. So before it was just like they would go out and then they'd see somebody, and the only way that they got paid is if they brought them into the emergency room, which wasn't always needed, but that was kind of the path that they were all on because of the way the billing was set up. And they're able to restructure those Z codes, and they're able to treat them in their home, which was more cost effective and just more effective overall. And they still got reimbursed. So I think it's a great conversation to have around that.
You're right, Amy. That program's called Treat and Refer.
Yes, thank you. I was thinking catch and release. I'm like, that's not right.
Well, I like fishing. That's okay.
Awesome. Thank you.
Wonderful. Thank you, Sam and Mauricio, for adding to that, and Amy. Anything else from the highlights we'd like to bring up? In specifically any, of those ideas or parts of the ideas, strategies that you thought were intriguing, or even the outcomes, things that you want to really work toward?
There was another point I brought up from the other gentleman from MTA. I forgot his name. I apologize, but he was talking about adaptability and flexibility. And I just wanted to also bring up that is a huge factor in what we've seen is effective in providing transportation to any person where they're at. We've talked a lot about people who, like the digital divide, people who are not comfortable for whatever reason using a portal or using a passenger app. We've encountered this as well. It's frustrating because that would be most likely the most efficient method if everyone were to do it, but it's not the most efficient method if people are just not going to do it.
Yes, thank you very much for adding that. Those are great points. I think it was Andrew Lang mentioned that.
To piggyback on that, and to I believe Miriam had a comment on this, but the faith-based organizations comment about those types of resources, I guess I feel like that's something I've kind of heard that, hey, that'd be always a great thing to look into for the last 5 years, and maybe I just haven't necessarily kind of stumbled into it or haven't been as proactive. But I am curious, is there a role for the faith-based organizations to support with that, bridging that digital divide as sort of kind of a liaison or supports for certain individuals? Is there a way to kind of tailor the two together with a large volunteer network?
Yeah, there are organizations in Arizona that are starting what they call digital navigators. And those are going to be for folks who have really low literacy when it comes to technology. There's already healthcare navigators or community health workers that already help individuals apply for government assistance. But digital navigators are going to be focused more on just the very basics with technology, because everyone is kind of like at a different level. So it may be just, how to turn on a computer, how to set up an email account, just very basic, and then kind of build from there. So there is that coaching training that needs to happen.
Mauricio, is that something that's already been implemented? Is that something like, is there?
Yes, the digital navigators
on that?
Yeah, actually the state libraries are the ones who started this digital navigator program, and I'll put the link in there. Because
Awesome.
Some of you may be aware of this, but there is a $30 a month subsidy for low-income families. It's called the Affordable Connectivity Program.
Yes.
Where people can qualify and get their internet for $30 a month, and the government will pay subsidies for that. And if you live in tribal lands, I believe it's $75. So this digital divide really started taking a lot of steam when the pandemic hit, because everything went, everything became virtual. But there was even if you have a device, no matter what it is, if it's a tablet, a laptop, or a cell phone, but if you don't know how to use it, or if you don't have the internet to be able to connect to, you basically have a paperweight. So a lot of education needs to happen. They even call it, maybe it's part of the equity. Digital equity is very big now, because everything is based on the internet. So there's a lot of programs, and I can put that information in the chat as far as the digital navigators go, and creating more programs like that.
We have a Tech Connect program that we do with our volunteers and our seniors, where we teach them all about, how to connect to the iPad, how to get started, how to create an iCloud account, how to create an email account. But if you have a source that already does that with someone, and we can partner with them to have them come in and teach the classes for us, that would be, even better. So thank you, Mauricio.
I'll put that information in there.
I'd like to add, we have at Rice to Wellness, we have a travel trainer that does a lot of training to those that are not equipped, or just don't feel like they are equipped to, to learn, first of all, about the traveling part, how to board vehicles and things like that. So we do use him in certain parts of those areas, but we also have those mobility navigators that we mentioned earlier. And what we have found that for those that struggle with, those that struggle or just is pretty much emphatic about not wanting to use the passenger portal or the tech part of it, those navigators will help them personally. So it's just a matter of assigning that particular client to a mobility navigator, because we do have those issues. And they just either, maybe they have a disability that does not allow them to, to use technology. So we do have our travel trainer and also our mobility navigators that can help out between whatever technical need and transportation parts of boarding and unboarding and those things like that. So, and I did hear someone say, talk about travel trainers. So our travel trainer is equipped to help out in many of those areas.
Thank you, Tracy.
I would, oh,
Nope, sorry, go ahead. I'm cutting you off.
I would just like to input something that Todd had mentioned before lunch. It was in reference to commingling. And one of the couple of the things that I kind of took away from this morning was partnering plus the commingling aspect of that, sharing rides. I think, Todd, if I remember right, working with Assisted Independence. And if I'm going in the wrong direction with that, please help me. But we were partnering in sharing rides, helping each other, but also because our services are free, we do not charge a fee. And so in working with Assisted Independence, we were reimbursed for the travel on that. So I don't know how I would like more information in that area.
Sure, Linda, I can definitely kind of jump in. Yeah, I think that there's a lot of different ways to look at that that concept, but I think you guys had a great example of a kind of shared ride system where for the larger group, both Linda's program and another agency are both kind of serving in the general northern Arizona Tuba City area, Tuba City in the Moenkopi village. And they were sharing trips. I think that the commingling piece is maybe a way to expand upon that potentially in looking at different billers and different funding sources that are paid for certain client types or certain populations. And so I think that's just one way of looking at breaking down those barriers for that enable, similar to what you talked about with one agency charges fares, the other one doesn't. This would kind of also expand upon that to also being with different funders, I guess, but all trying to kind of maximize all those seats in that vehicle.
Yes, thank you.
Okay, we have something in the chat, but I was about to move on to challenges. Does anybody else want to add to the highlights before we kind of slightly narrow it down to the specific challenges that you could raise in relation to your service areas or what have you?
Just sorry, am I unmuted? A huge takeaway for me today was the ways that people seem to be reaching out to their local healthcare systems for partnerships. I think that through identifying those costs that it's taking for lack of ability to discharge on time, and other kind of the communication pieces, dialysis, I think that's huge. And I guess I'm really curious if there's angles through kind of this platform that we're hoping to set up to build upon those. But if that's something that the group is seeing that there's applicability within their kind of world as well. So.
Great. I think we have that on there, Andrew. But yeah, I think that's a vital data point that can be used locally. It could be aggregated statewide, show that X dollar amount is costing the system because transportation is not allowing people to get home. So that would be crucial down the road.
And then Eric, there's something posted in the chat. I'm not sure when you wanted to address that. Specifically the question about, are there other recommendations on how to encourage technology use, particularly in areas where technology is hard to come by because of connectivity and also with the population maybe not being receptive.
That's a great segue to our challenges. So I'll read this one to get this one going. So Carrie shared that on the reservation, elders do not wish to use technology. They would rather have their appointments in person. Also, being in such a rural area, internet service is not very good here and drops all the calls, drops during calls. As of today, all individuals will be transported to the nearest facility for an in-person appointment. However, due to the shortage of drivers and funding, we are not able to accommodate all their requests and are denying transportation. Any other recommendations on how to encourage technology use? So that one, there's a lot to that. I guess the technology use by the population, specific members of the population, but also then infrastructure in certain service areas. And maybe anything else. See, Carrie, if you're there, you're welcome to chime in, share a little bit more, elaborate further, or folks can chime in and share if you're experiencing and seeing similar challenges like this in your area.
Oh, sorry. Go ahead, Sam.
You go ahead. I've been talking a lot.
No, that's good. That's why we're having this, for people to talk. So that's perfect. No, just to answer the question about recommendations on how to encourage technology use. And I'm not sure if we've touched on this already and I missed it, but just in case, one of the things that we've been talking about, I think Ken Ellsworth has joined us as well from Verde Valley Caregivers Coalition. So he might have some thoughts on this as well. But one of the things we've been looking at is, can we develop like a Zoom suite, or could we equip local nonprofits to be able to have the technical equipment and the volunteers who know how to use that equipment, and bring people to their offices in order to, for example, participate in telemedicine appointments. So then the older adult wouldn't have to know how to do that on their own. They wouldn't have to use their own devices. They could go somewhere, get assistance, that people are right there, and then they can help them through that challenge. And so it seems like maybe that's something that could be useful. And particularly if there are others interested in piloting out something like that, then let me know, because it'd be great to kind of bundle together a pilot project that would be statewide on that, and then to seek support for it.
I think that's a great idea, but I know that like right now, especially here in Phoenix, I know the city of Phoenix, before I left, had just equipped every single one of their senior centers with brand new technology, brand new laptops, and the staff was fully equipped on assisting them. So maybe partnering with the city and the Human Services Department would be a benefit to you or to anybody trying to pilot that program. I know that with us at AmeriCorps, we're teaching our seniors how to use the iPads for that purpose, so that when they are helping a client, they don't have to figure out technology on their own. They can simply bring their iPad. So if you want to send me something and you want to try to partner up, I'm happy to make your acquaintance and figure that out. Because I know that that's something that we're gearing towards, and that's something that we're preparing our volunteers to do, so that they are bringing that technology portion of that we're offering to the actual clients themselves at home or wherever it is that they get Wi-Fi.
That's awesome, Miriam. Thank you. I know the Veteran Services Administration was also, they received grant funding, and they were establishing those hubs as well. I think you're jumping in, and then Sam after that.
Yeah.
Ken?
So, it's really a big deal, actually, getting people set up for virtual care. According to healthcare industry experts, within 5 years, 70% of all primary care appointments will be by virtual care. And so our population of about 2,000 riders here who don't know how to use any kind of technology device, and usually don't even have adequate Wi-Fi. So it's been a real challenge, a very big challenge. And also the same industry experts state that they will soon be going to remote patient monitoring devices. So what they'll need for this population that we're serving, they'll need an assistant to go out to the home to help them set it up and make sure it's working. It will come with its own Wi-Fi setup. But anyway, I think that might help at least to curtail some of the cancellations and the missed trips that we go through. And the other issue behind all this is how much of a lack of healthcare providers we've had since COVID. We've lost 40% of our healthcare professionals in the Verde Valley over the last 3 years, 40%. And so about 30% or more of all of our trips are long distance. So that's the other issue that's really difficult. Which means that we have to, for some of these appointments, we drive 200 miles each way, 400-mile round trip in one day to get a person to one appointment. So, and if that appointment is canceled and the rider doesn't know about it because they didn't get the message from the healthcare provider, and that's a lot of wasted time. So the struggles are really there. And I'm just hoping we can all work together to find some sort of solution. So I appreciate everybody what you're doing. I really do. Thank you. Thank you.
Sam?
Yeah, if I may, as I've been listening, I actually had an idea on this. I grew up in a very rural community as well. What about something like a mobile Zoom suite? I know they have like those big mobile vans for blood drives. It sounds like the key here is people are going to need basically in-person help even to access digital services. But we could still reduce costs by not having to bring people together, but just bring the technology to the people.
Yeah, I agree with that. There's a lot of that already taking place. There is a telemedicine program here in Arizona. I put Janet Major's contact information. They have been piloting some programs with the libraries. It's called telehealth in the library. So it doesn't have to be a library, but the libraries seem to be like a big hub in local communities. But I'm thinking it could be a church, it could be a school. Where you can have that technology that everyone is talking about and maybe having volunteers in there to help folks access the internet or provide training, things like that.
But even more than one single fixed location, you could have a large bus that goes to each of those locations.
You are correct. They did that through the pandemic where they attached like a hotspot to school buses. And they parked them in neighborhoods where they knew that there was a lot of kids that needed to have that internet access. So they did that already for the pandemic, but there's no reason that those kind of innovative programs can be expanded or enhanced. And I know that in Native country, they're using like the chapter houses as hubs, because chapter houses are like where people that live in different tribes throughout northern Arizona. It's kind of like a gathering place where they have resources, information, even their local government meets there. So using those chapter houses as those hubs, they're also trying to try some pilots by doing so as well.
That's good. I like to say, we've applied for some funding to buy a small motorhome for that purpose. So in other words, it has an electric lift, so it's specially equipped on the side, and then it's restroom equipped, and it has all the Wi-Fi stuff up above and a big screen TV. And so it's all set up. So I'm hoping we'll get awarded for that. That would really help a lot.
That's great.
Andrew, I guess just in looking at the notes here, I think it's really worth capturing the comments around the libraries as a potential, to piggyback on what people are already doing, that the fact that the libraries are doing it and capturing that contact personnel. I'm curious if, I think that seems like a really great angle to try to loop in that individual to this in-person workshop to see if there's ways we could kind of further enhance what they're doing and add that transportation arm to it.
I like these ideas around kind of just as a general catch-all, the telemedicine hubs, mobile clinics, particularly cited at libraries or the tribal, kind of gathering points. Anything else kind of in relation to those?
Miriam, that's a great point about the city having free Wi-Fi hubs in the parking lots of parks. That's really good.
They started that right before the pandemic. It was something that went up prior to the pandemic, and during the pandemic we found out that it was like the best thing we could have done to help mankind, because people were isolated, they had to stay separate. People could stay in their car and still come by and use the free Wi-Fi. But yeah.
So what other challenges are kind of you experiencing in your areas? Someone chatted.
For me, the challenges that we have, because we don't have big buses, we don't have transportation. It's more individual riders, individual volunteers who take their clients in their personal vehicles and they, you know, run errands, go to the grocery store, pharmacies, whatever the client needs. For me, it's more the price of gas, the price of gas that went up, and like our inability to kind of pay them more. So we've kind of reached out to our president and or the CEO of our organization, and we just keep, you know, asking for more money to be able to give them more funding, like more money, and like not restrict them on that 300 miles per month, because the people that do serve in the rural areas, I forgot who was saying it, they go a really long distance for 1 or 2 clients and they've met that cap. And so it kind of puts a restriction on that volunteer of whether or not they can help another person that month or that week, because there's restrictions on the mileage that they're allowed to kind of travel in order to get refunded the state mile rate. And so it's that balance of, okay, you know, can we afford to give our rural areas more funding because of the restrictions when we're trying to be uniformed across the state so that everybody, you know, it's a fair playing field. So it's hard because some of our driving volunteers, they stopped driving or they retired right after COVID. So we've lost a lot of our driving volunteers. And so recuperating and or getting new drivers to, you know, come in, it has been hard. So I would say recruitment, you know, recruiting volunteers at this time to drive through the unknown, because sometimes, you know, they still have that reservation of, especially since we deal with the vulnerable population as it is. So they still have that little reservation of, oh, you know, I don't want to get this person sick, or I don't want this person to get me sick. So I think once we pass that hurdle of things not getting back to normal, but to the new norm, as people keep saying, I think that that's going to kind of help us in that manner. But that's a huge restriction for us, or a challenge.
And thank you for sharing. Any other challenges or difficulties in your area with transporting people, or how is the coordination look in your particular areas? Go ahead, Todd.
Another challenge that I think is worth capturing here is, I do think, especially as reflecting on this morning's presentation, there seem to be a lot of really proactive partnerships with Medicaid and Medicare. I do think that in Arizona, at least in northern Arizona, it's kind of been a hit and miss on how impactful those partnerships. I think there's a lot of additional opportunity for more robust partnerships with the CMS division. So
that's great. There's that's a whole thing in of itself, and about 2 more prompt questions we'll be talking more about partnerships. I'm going to put a pin in that. We can kind of brainstorm more around that in a minute.
Hey, Eric, can we take care of a couple of questions in the chat? Would that be okay?
Yes.
Hezekiah's asked Ken if the RV, Ken, the motorhome that you're looking at for the kind of mobile Zoom suite, is that ADA accessible? Do you have a ramp or a lift for that?
Yes, it has a lift. It's electric lift on the side, so it has a fairly high capacity for those extra large wheelchairs, or especially the electric wheelchairs that tend to be very heavy. So it can handle that.
Perfect. Thank you.
And it can handle passengers, 4 passengers plus 1 person in a wheelchair.
That's wonderful.
But we could use it as a stationary device and have it set up. You know, it'll come with a Wi-Fi antenna and all of that. So I think we're looking forward to that. I hope we learn by, I think it was June or July, we should hear.
Yeah, definitely. Well, good luck. That'd be amazing. Please keep us
Yeah.
posted on that. And Miriam, who's setting the volunteer driver miles and reimbursement restrictions?
I believe it is our, I don't know if it's our own policies and or like a nationwide policy that is from AmeriCorps themselves. So I'd have to look it up, but they're
Okay.
restricting, they restrict us on like the pay and then how many miles they're allowed to drive.
That's
So,
driven by concerns about funding, right? Because if people are submitting for lots of mileage reimbursement, it could exhaust the funds that you have pretty quickly.
right. And thus far, we've been doing really good. We had an overage a little bit, but now that things are kind of picking up the pace, we're kind of going, oh my gosh, like we picked up a lot of new volunteers in rural areas up in Mojave County, especially. And with about 20 volunteers within the last 4 months. And so I'm thinking, oh my gosh, like these clients are only going to be able to, these volunteers are only going to be able to help so many clients due to restrictions and stuff.
Got it. Okay, great. Thank you. And then Lindsay, you had a question or a thought about cultural challenges and limitations who can interact?
Yeah, I just wonder, if anybody's experienced challenges with just, making these connections and forging these relationships to ensure that folks feel safe and comfortable accessing these technologies. I come from a background where we were pretty Orthodox Jewish community. So, I just wonder, because sometimes there's resistance related to culture. And so I just think that's something worthwhile.
No, that's a great question. Does anyone have any experience with that or insights into that?
I think that's a great point to bring up. One of the biggest challenges when trying to implement a new initiative, no matter how great it is, you always have to trust those local folks that people trust to be able to maybe carry that message through. So it could be a faith-based leader, or it could be, it could be really anybody that the local community trusts, because that's what you're trying to do, build trust. So looking for those local champions to kind of help you with the messaging or the talking points, it's always key for any new initiative.
I'll chime in and say that that kind of thing is a challenge, not just around the use of technology, but even the use of a transportation service at times. We've recently been developing policies to address some issues with I would say cultural conflicts between passengers. We've recently started transporting more than one passenger at a time, and we've realized we've also had to address, we want to make sure everyone feels safe in a ride. So with the population we serve, mostly people experiencing homelessness, sometimes there are particular conflicts that arise, and we've learned that we have to actually track those and keep certain people apart from certain others.
Yeah, thank you, Sam. Any other challenges that we'd like to add to this one before we move on to the next piece? By no means is this an exhaustive list of challenges, or certainly this is just an exercise, but these are great so far. Thank you for sharing. All right, well, Andrew, oh, go ahead.
I don't know if it fits here, but the human capacity challenge is what a lot of our agencies are experiencing. And I know we're talking about, mobile sites, for Wi-Fi, mobility navigators, but that would be one of the challenges. I know probably at almost everybody here, we're doing multiple things. We have multiple jobs, wear multiple hats. But the human capacity, if we were to roll this out, where do we find those navigational, mobility navigators, where we're going to find just volunteers to help, roll this out.
That's a good point, Didi. I think what we've done is reach out to local colleges, universities, technical schools, because the internship opportunities, I would say, because they're always looking for those students to have hands-on experience. So tapping into our education system, whether it's a university, community college, or even a technical school, that would be a good place to offer those internships, hands-on opportunities.
Mhm. Well, and then related to that, is a training for the workforce too, right? Like there's a question from Kathy to Miriam about the driver requirements. Is it level 1 fingerprinting, CPR, driver's training? I know Didi and Hezekiah have done a lot around past training. So making sure that you have the workforce and that they're fully trained and they have the right clearances. That
I actually answered Kathy. I sent her a private message, sorry, but yes, our drivers are all fingerprint clearance, and I'll just drop it in the chat for everybody so that you guys can see the type of background checks that our volunteers have to undergo in order to become volunteers with us. But I dropped it right in there. We had what was like a defensive driving course that we were doing with them, and I think JR was going to help us to kind of develop it a little bit better, so that we could still, it's like, because it's not a requirement, but we still do it with them just as a precaution, and provide it as a training every year. And then we also do a safe return to service training as well with them that deals with COVID and returning back to service with COVID in mind. And then the other question was, let me see. They don't have a level 1 fingerprint clearance card, but they actually go through all of that. They just don't actually receive the card. We don't give them the card. We know that they've passed it because we put them through it, but we don't give them the card. So if they go to volunteer at, let's say, any of your agencies, they go to volunteer at your agency and you require a fingerprint clearance card on top of the 4 checks that we've already done, state, local, and national, and then an online data name-based search, then we ask you to cover the cost of that fingerprint clearance card for that volunteer. Because primarily our people are either low income or live on fixed incomes, and so they can't afford to pay for anything, you know what I mean? Well, not anything, but it's a burden on them, and we're trying to get them to volunteer for us so they don't pay for any of the background checks. We take care of all of that. Usually most of our partner agencies are okay with us just letting them know, hey, this particular person went ahead and passed these particular background checks, and if it's good for them, then they just go ahead and start the partnership. And they asked about training with regards to CPR. Our volunteers are a support to the caregivers, to the clients themselves. They are not licensed nurses or caregivers or nursing aides, so they don't do medication or anything like that, but we do provide training for them. And we let them know that, like, you're not required to do these things, but in case of an emergency, this is what you would do in this particular instance. And they take it upon themselves to then, render aid when necessary. But usually there's a caregiver in the home or a phone call away. So we're more of a support for the family, the husband, the wife that, doesn't get the chance to get out because, they're busy at home taking care of someone that has dementia. So it's more of a one-on-one situation with that.
Thank you, Miriam. Now we're gonna move over to this what support and tools do you need section. We can always go back a little bit if things come up, but I want to recognize that we have about 15 more minutes of this session. We can maybe go a little longer so we're ahead on time, but there's also day 2 over a month where we can really dive into this. So there's a lot more to explore here. But, and of course, this one relates to more of a concrete type of service or plan. So you might want to spell that out in specificity a bit. But what tools and support might you need to X, to do something? So what might those be? Anyone want to dive in with some thoughts?
I would like to say something. One of the comments I made earlier was basically many people, simply don't know what services are available or how to learn for more information. I think that's something we found in our public engagement, even virtual public engagements and reaching the communities that can't get transportation in the first place is something that we have an issue with in our region. And so that's what I'm going to be working on this next year, of course. How do we get this information to our communities that we need to serve? And then hopefully we can start with introducing the technology, because a lot of the comments that we've heard is that they just don't know they don't know they're out there. For example, before I started working here, and even if this last year, my parents didn't even know that there was transportation options, and then my parents, so I've explained to them, there's all kinds of stuff out here that you could have access to, so dad doesn't have to take you and things like that. So that's the comment I wanted to make.
Great. Yeah, that's a big one. And frankly, why we're choosing to do this and why we had 5 different organizations share what they're doing. Not that it's the model that you need, but it's a problem that's universal. So thank you. There's a lot to unpack there. We have a comment. Oh, yeah, somebody's agreeing that this is a huge issue, and partly to the limited availability of funding for advertising and marketing. So thank you, Lindsay, for adding to that. Yes. Yep. Go ahead.
I think we need champions, community support too. We need champions in the community, because going to the options that are available is a lot of these options are for people who are homebound or don't have any other resources. But then how do we reach out to them? Especially, and we've heard this, especially for our cities that have a larger older adult population, that don't access public transit, they don't have public transit in their areas, they don't go to a senior or community center. How do we reach those individuals? Because those are the ones that are needing, the services the most. How do we cultivate community champions?
And Dee Dee, if I could speak to that just really quickly, I think it's worth mentioning that you and Hezekiah have a pretty robust local, in my world, we call it the local coordination committee. So, your mobility managers. I really like how you have a diverse group there, and I think it really helps to that end. So I think that's a model that we need to be talking about a little bit more.
Yeah.
And Andrew Lang from Flint chimed in that people may know of a resource, but also feel shame from reaching out. Quotes, "Oh, that resource was for someone worse off than me," and such. They encounter that a lot in Flint. So I think that's kind of a universal type of thing within our society. So having that cultural navigation, kind of social navigation, local person who can really do that local knowledge type of outreach is critical in something like this. But thank you for adding that, Dee Dee, Andrew, and Lindsay. What other supports or tools specifically might you need to overcome some of these challenges?
I'd like to add that I think we personally could do with more technical and logistical supports. I don't think I added this to the challenges yet, but we've had a real problem with spikes in demand, and I'm not really sure how to term this, but overlapping availability of specific SDOH services, which effectively is a spike in demand. If there's only a 2-hour window where 10 different things are available that people desperately need, and we only have 5 vehicles and drivers, how do we allocate that? And we're using as much as we can technology to streamline that allocation, but I mean, that in itself is a very complicated problem.
Absolutely. Thanks for getting that on the board, Sam. Tracy also shared that just vehicle availability, expanding fleets with the backlog of supply chains and things is a major problem. So that alone is kind of hindering ability to scale and meet the need that's out there.
And if I can add a little bit to the vehicle availability, it's also the funding and opportunities to get the vehicle availability, because one of the things that we're struggling right now on the 5310 is just related to the Buy America regulations, and it limits the type of vehicles that agencies can get through grant processes that have federal money on it, and it also make some of the vehicles that are available are the high cost vehicles, which because there are matches, it makes some agencies not willing to put the money in there. So I think it's not just the availability of the manufacturers, but also the cost and the ways of getting the money for those vehicles.
Thank you. Thanks for adding that. That's, yeah, a major problem across the country. Todd?
Yeah, I'm trying to think of how I'd want to say this, but I think in terms of the supports that may be needed, I think this has been a phenomenal conversation, and there's been some really good resources. And I think that there's a lot of things that different entities are kind of doing that maybe aren't necessarily in line. And I think transportation can often serve as like a really great all-encompassing element. And so like just what we heard today about the libraries wanting to set up these mobile clinics, as well as, I forget, we had it on an earlier posted note, but the whatever the tech navigators were. I mean, it seems like that there's some pieces here, and I'm curious if there's an angle for transportation to help kind of combine them all, or bring in multiple entities to have that discussion. And so from a support standpoint, I guess I'm trying to think how to frame this as a support, but I do think that there's a need for transportation to be supported in those conversations about its value and its role in connecting these multiple missions that are all very similar.
In terms of the, oh, go ahead.
Sorry, go ahead, Sam.
Oh, I was gonna say, in terms of the communication between entities and resources, I know 211 and Lyft and Ride United had a partnership, or still have a partnership going on for a while. Could we perhaps bring 211 into this conversation in a broader context? And like, could they be a central hub that keeps track of, I mean, they're supposed to be a central hub of what resources are available, but I know when I've gone to use it before, 100 out of 150 links are outdated. So I wonder if maybe we could partner more closely with 211. I mean, my drivers are on the ground. They know the current hours of the local laundromat. Is there some way we can have maybe a two-way information street?
Mhm. Absolutely. No, I think that Solari would be a great partner in this. The other resource is Easy Ride Info. So it's a statewide centralized database of human services transportation providers. And we've shared our information with 211, and Unite Us is another provider too. They've got a statewide contract, and just, I think that could be a really important partner to leverage too.
Well, that's a great segue. We can obviously come back to this part, but down to our kind of two bullets here on the Miro board about partnerships. So who in your area should you partner with? This is kind of has some notes already on it, but who, we've heard this earlier in the morning. I don't want to, give anything away, but who should you locally, regionally be thinking about needing to pull into the fold here to instigate some sort of service or program in your area? Healthcare, social service, but specifically, who are those connecting points in your area or region? Also, the second one is who in this room can you work with across the state and kind of make some sort of a coalition? So there's 2 points to this one to be thinking about. Feel free to share this out or just think about it, because it's, might be more local to you, but who are these kind of partners across the state or locally that really need to be brought together in some sort of a coalition to make any of these programs actually be sustainable?
I was going to be selfish and say, me, partner with me.
All right, we got one. There we go.
Partner with AmeriCorps. I know that the governor's office is really pushing for us to, kind of expand as well. So AmeriCorps seniors, the mayor's office here locally, we've just gotten a huge support from them. So partner with us.
Great, I love it.
I'm going to throw pharmacies on here just because it's been such a recurring challenge for us specifically. I don't know who else, I'm curious, who else here has transportation to or from a pharmacy. Does anyone else do that? Yep, you do. Yep, maybe we should talk more after this. Yeah, we have had. Yeah, I'll just leave it at that. We've had issues with pharmacies.
Oh, see, we work with our clients. So the volunteers work directly with the clients, and then the first time they'll go with the client to the pharmacy. And then after that, like the local pharmacist gets to know our volunteer, and they understand that they're picking medication up for someone else. So it's been a smooth transition. So sometimes the client's with a volunteer and sometimes the client is not, just depends on what's happening. Is that what you were thinking?
No, actually, no, pharmacists have actually been really excellent in that regard and working with us, because our main driver who does the pharmacy runs, he has a badge ID from the hospital. Like they can see that he's representing the patient in that capacity. But I thought someone was going to say something. Anyway, it's the issue we're having is just logistics internally in the pharmacies themselves, and how that affects the patients and how that affects the logistics of our transportation operations. If we had a pharmacy recently that they wouldn't even give us an ETA on when a medication would be ready. They just didn't know.
And I think that's because on their end, they're having shortages as well. And so it's getting the product to the pharmacy that's been an issue. But that's the beauty of our program, is that we can come back, when it is ready. So that patient will get that medication that they need. So if it's a matter of having somebody swing back to grab it that you guys are having an issue with, and maybe that's where we can support you guys or anything like that. No?
You can do that too. No, this is so it's multiple entities involved. So we have a hospital that we have a pilot program with, and then the idea is that the patient will be discharged as soon as that they know that medication will be ready, so that the patient is not having a gap in care that could return them to the hospital. So, basically the caseworkers are discharging the patient. They say the order's put in, the med should be there. We get there, the med's not there. It might not be there for a couple of days, or maybe we don't even know when the med's going to be there. At that point, either we bring the patient back to the hospital. Sometimes the patient doesn't want to go back to the hospital. And then we have a patient returning to the hospital a couple of days later because they didn't have their urgently needed medication.
I kind of would like to add something to that too, and taking into consideration, where the person might live or they're receiving medication. I know Walgreens, for example, they've agreed to ship my medication to an address, and depending on their living situations and stuff like that, a location. But I know that some pharmacies are starting to do that with courier service, so free of charge. But I don't know what prescriptions or limitations of it. I just actually, so it just wanted to bring that up too.
Yeah, no, we've begun actually internally tracking what availability of options, what options are available per pharmacy, but that's a lot of data. It's just a lot of it's a lot of
Walgreens was the one that I've seen it work for me, so that's where I'm like, okay.
This is where we've been asking the caseworkers at the hospital to direct their discharge referrals to specific pharmacies, and it's this is what I'm talking about. It's like we're transportation and we're like, okay, pharmacy, okay, caseworker, you all need to talk to each other.
This is Linda. I had seen in the chat box where Carrie had mentioned partnering with healthcare and tribal leaders, and I see tribal leadership up there as a partnering. And I think healthcare, and I mentioned it before, the Tuba City Regional Healthcare Facility, also the Hopi Healthcare Facility. I think by partnering with both entities, because I don't think, as I said before, they have anything set up to as far as transportation. And I think that's why I wanted to mention in their quarterly meetings that this is something they need to think about doing, because they are expanding. They're building a rehab center here soon. So this is in Tuba City. So they are going to be growing quite a bit here pretty soon. So, and as far as partnering, I think Carrie and Donovan is with Hopi Sinam. It's a transit, their transit on Hopi. I think we talked about this before as far as getting together to work together. And I think if we get our entities, you know, if we set up a meeting to see what we can do in our areas, I think this would help us in solving some of our problems. We don't have too much out in this area that like some of you do in the bigger metropolitan areas in the cities, larger cities like Flagstaff, Phoenix. You know, so we have to really look for those services or try to develop them somehow within our own area.
Thank you, Linda. Yeah, absolutely. A lot of this is you know, homegrown, literally. So
yeah.
The more it works within your local community and the partners in the community, you know, the more successful it can be, which is in part why we want people to identify who nearby needs to come to the table for this effort. We have a number of things in the chat here. I just wanted to quickly call out. So yeah, local healthcare and tribal leadership, depending on the region. And then I think a general theme is just also have, you know, in some instances it might be tribal areas that are, you know, difficult to work with or not involved, but also just other entities or sectors not wanting to kind of engage in this effort, because I think they don't do transportation. Why do we need to talk about this? But that's when that data piece and other things that need to kind of come in to convince them that the effort is not just transportation related, but it's the cost of healthcare, it's cost to the community in different ways. Something that we'll maybe refine in day 2, but that's a big challenge for a lot of areas. And then a couple other things related to social determinants of health across Arizona. Thank you for adding that. We'll capture these. I'm saving them. I'll put them in our resources toolkit for the future. But any other partners, either here in this virtual room, but things that you'd like to identify that has worked in your areas that you know that you need to reach out to, that you'd like to get on this board. Because if it works for you, it might be kind of instigate an idea for other folks in other parts of Arizona. So it's like would be helpful just to raise it to the group at this time.
Healthcare agencies, we have a partnership with the city of Scottsdale, food banks. We have a partnership with a lot of other just social services agencies. Being on the Human Services campus, I mean, there's 16 nonprofits right there. We've been trying as much as possible to just have closer ties, especially with agencies that provide mental health services or substance abuse prevention services. I could list a few more if you want.
The more the merrier, I think, at this point. Thank you.
I think in every state, there's federally qualified health centers. And they're usually the centers that are out in the rural parts of any state. I know that in Arizona, there's probably over 22 different federally qualified health center entities. And each one of those entities, they tend to have 5, 6, or even more locations spread out throughout their service area.
Yes, that's a great one that we haven't talked about yet, but FQHCs are great partners and do tend to be in the rural frontier type of communities. Todd.
I think we talked about this before. I just want to make sure it was on a note, but I do think that the Medicare, Medicaid, I think that's a huge untapped piece here. Yeah.
To go to your point, Todd, I don't know if the folks on the call may be aware, this has been going on for the last 2 years. The state of Arizona has been developing a statewide closed loop referral system. It's called Community Cares, but it's a number of key partners that are part of this whole person care initiative. Some of those partners are obviously Access, our Medicaid agency, Unite Us, Solari, 211, and Contexture. And what they want to do is roll out this SDOH platform to track referrals, to send referrals, and to make sure that when a referral is sent out for a SDOH, that it actually gets tracked whether that individual received a service or they didn't receive a service, or kind of making sure that when we're sending stuff out, that we're getting a response on the referrals that are sent out. And Unitas just became the local platform to be utilized as this closed loop referral system for the whole state. And actually, they're incentivizing community-based organizations to utilize the platform. I think they have a tier system up to $10,000 for a community-based organization to utilize and be listed as a referral source or a receiver of a referral. So it might be good to look into possible partnership opportunities, and I put those links in the chat.
Thank you for adding those. I will make sure these get on our board.
Yeah, just quick question. There seems to be an awful lot of information in the chat. Is there a way for us to like download the chat afterwards to capture all this?
The chat will automatically save to my computer, so we'll be
You
able
can
to
always copy paste it too.
There's actually 3 little dots at the bottom. If you click on it and click save chat, it'll save a text file.
We'll make sure we get it saved. Thank you.
I wanted to quickly follow up on Unitas. I've been following this for the last month or so as well. I love the idea in theory. I've got to say, I've not had a lot of luck following up with specifics regarding the software, how it can be used, whether it could be integrated with our dispatching software in particular, because I think somebody brought up this point earlier, but I forget who. Somebody was talking about being overwhelmed with the number of different apps you have to use when you're making referrals. And that's sort of my concern with Unitas as well, is that if we have one central platform, everyone will want to use that and use that exclusively. However, as transportation, we need people to send us dispatch information specifically. Like, you can send us the patient's name and the MRN, but if we don't have their address, we can't do anything.
I think it depends on how you plan to utilize it. Unitas, the community cares platform, is a web-based platform. Obviously, if you want to have more of a robust data collection report, then you have to talk about more of those integration with whatever systems you have. I believe that your organizations that might be integrated into the HIE already. I'm not 100% sure about that.
What did you say?
Contexture, HIE, Health Information Exchange. Are you guys already tied into that?
No, we're completely independent from everything as of right now. We're not even on HMIS.
Okay. So the HIE is the statewide system where the health information gets stored for the different kinds of providers, hospitals, community-based organizations, clinics, doctors' offices, etc. So you are going to run into some of those challenges. Some people say, well, I don't want to duplicate services. If I'm already using one system, why am I going to use another one? But I think they need to have this conversation so they can come up with the best way to integrate into the different platforms that people are using. I know that the food banks probably use a completely different platform than anybody else to track their activities and their food distribution, just like HMIS tracks all of the individuals that might be unsheltered or homeless throughout the state. So you are going to have those technology integration of who's talking to who and how are they compatible. So that's a good point. And that's a challenge too.
I can help answer that question. We at Equality Health just onboarded. We're live tomorrow on Community Cares. And what I can tell you is that they, I know Mauricio mentioned about HIE, but they don't integrate with all the platforms. I believe it's just a hand-selected few that they already integrate with, and they're working on some other ones. I think it's the top 5 for now. So it would be something else that you would have to open another app with. Like, for example, we have a care center, and they don't integrate with our EMR system. It's something that we're looking with, as well as for our care teams. We have a platform that we use. So I would say similar to what you guys use. And we're working on integration, but it's something that they're willing to talk about, but it's not something that you could get going right off the bat once you start. It'd probably be a year or two after you join the platform. But you know, the tool is there and it's good, and it has a lot of CBOs already on there, and it's a statewide initiative. So I know it's a hassle, but sometimes just to make sure that the loop is closed, it's sometimes worth the extra step.
Could I add to the tool supports board, if there was some way to have assistance with these types of integrations, tech support, basically. I mean, I understand the concept of what we need, but I don't have a background in coding. Something like that for these types of system advancements, especially when we want to make it work smoothly on a statewide level, that would be phenomenal.
Great point. And even, you know, contractual or legal type of support to make sure that the health exchange and the healthcare provider, you know, it's easy for them to fall back on, well, you know, that's risky, we can't do that, blah, 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 HIPAA and all those things, but there are ways to work through that.
I'll take that comment as a great chance to put a plug in for other technical assistance, where we pretty much would walk you right through that type of thing. So if you have a project that you are trying to get started, figuring out how to start, then we can work with you. So if we don't know what to do, then we bring in someone who does at no cost to you.
I'm just learning about this today. Thank you.
And I'd say that's even a potential area to at least initially investigate kind of through this larger technology summit and the multi-day approach that we already have established. There's angles there.
And then Linda added something to the chat, said our senior center years ago had partnered with Tuba City Hospital in setting up telemed in our senior center for elders. They could come and be seen via telemed by their physician. Thank you, Linda. Well, this is a great conversation, very robust. We have lots of ideas flowing around these topics. Is there anything else people would like to get on the board that they haven't so far?
You could add age-friendly Arizona to the last one for who here could you partner with?
Oh, great. Thank you.
Thank you.
Perfect. All right. And I'm sure, you know, I have some notes that I'll be adding to this. And I think we'll probably take this with us to day 2. We'll share it before then. So there'll be more to come after this, but we'll take this opportunity to transition to the next agenda item, which I think is the funding information before close out next steps. So thank you all for participating. That was a great conversation.
Eric, who's queued up to talk first about funding?
Let's see. I think, Andrew, that was us at NCAT. We're going to talk about various national, federal type of programs before we turn over to more local Arizona focused. So I can pull up, Andrew, I have some notes, but they're links that I can add into the chat that are related to certain things. I don't know if Andrew, if you wanted to have a certain place you wanted to start on this one.
Go for it.
Okay, so a couple things that I've been working on to come across my desk recently that I wanted to share with you all. In no particular order. Some of these are important to just have in your back pocket, even though the funding period right now may have closed, but these are cyclical type of funding opportunities. So it's important to just kind of pin them in a folder, come back to them on occasion. But it's the National Aging and Disability Transportation Center. Sorry, I need to make my screen bigger. But they have funding kind of various cycles. You can look at their past opportunities, which sometimes are indications of what's to come, as well as future funding opportunities. I'm going to put that in the chat, and then we'll have a better kind of reference list here in the future. But there's also the National Center for Mobility Management's issue-focused meetings. And this is a current opportunity. This is the Technical Assistance Center housed by CTAA, same association that NCAT is housed in, but the idea is designed to kind of continue this type of dialogues and networking and training around certain mobility practices within a region. So this is more locally focused. It's something that you can kind of explore, dive in if you have a coalition that has a particular need or general area that you'd like to advance. So I'll add this in there as well. Some of you may be familiar, but just want to kind of cover these in case you do not know. There's also the U.S. Aging Rural Health and Social Engagement Program. I don't believe there's any active funding through this, but this might be a great resource. One of those to kind of keep in your back pocket and just keep an eye on as it pertains to more of the rural engagement side of our communities. And then another technical assistance center housed within CTA is the Transit Planning for All project. And this one is an active one. And I actually work within, I have a foot in this center. So if you have any questions specific to this, you can reach out to me. I can put you in contact with the director. But this is kind of an all call for transportation, a transportation accessibility institute. And the idea is to convene people together at CTA's Expo for a day-long learning about accessibility. So it's focused to accessibility, but I think that could maybe fall within the guides of what we've been talking about today. So it's specific for people with older adults, persons with disabilities, caregivers, healthcare services, public transportation, kind of at large, and then local government and planning agencies. So it's fairly broad umbrella with the aim at increasing accessibility. And what's cool about this is they'll be able to get you to CTA's Expo for that day. If you want to stay on, it would be on the agency, but it's due April 12th, so not very long from now. And those who participate in this, it's kind of, it'll be a workshop for your community, and top 5, it's kind of a workshop, like a Shark Tank workshop that we're doing with this program, but 5 of those will be identified as communities of practice to receive further funding and support down the road. So I'm just going to put this in the chat. Again, if you have any questions, you can reach out to me, but the turnaround time is relatively quick on this one. And then some other things that you probably are aware of, but I want to throw in the chat, FTA's 5310 enhanced mobility programs. Grab that. If you're not aware, you can kind of read up on these. We'd be happy to provide more assistance and clarity around these. Just reach out to us with varying kind of windows of funding on this one. Same with their tribal transit program. Something to be aware of and on your radar for the future. I'm sure there are plenty of others out there. I know there are others out there. Andrew, you can kind of fill in if I missed anything, but these are the kind of the top ones that most groups like these tend to kind of direct themselves towards. And with that, I'll just leave it in the chat, but you can always reach out to me with any questions you might have.
Eric, I think that's great that they're in the chat. Is there any way that we could also just in the back end pop, maybe it's on the mural board or somewhere, just kind of house all those? I think that'd be a piece to
Yeah, they are now on the mural board.
Yeah, we'll make sure you get a kind of consolidated list of everything we've talked about today. So I think that kind of takes it from some of the funding opportunities that we've identified. Amy, if you wanted to talk more about age friendly, that would be great.
Sure, thank you. So through Age Friendly Arizona, we've been really fortunate in being able to draw down grants from national foundations, and we don't keep the money for us. We always grant that out to our community partners. And so if there's interest in partnering together and kind of bundling up some aligned ideas or some related ideas into one grant application, we'd be happy to help with that, and really excited and would be really excited to help develop that, find the appropriate funder, develop the application, and then submit it on behalf of our community partners. We are currently working on the development of the communication platform, as Jubileen had presented earlier, and we're entering into the demonstration phase right now, and that doesn't require funding. We will be also launching a pilot a pilot project phase probably sometime this summer, and we'll be looking for additional partners. So if you'd like to be part of that, we're looking for transportation providers as well as healthcare providers to work with us. And I'm really fine tune that prototype. The prototype, you can think of it like it's like a very basic structure. It's more of a skeleton. It doesn't have all of the refinements or all of the functionality that we would want for it. And so, for example, when we go to that production ready version, it'll have just a better looking user interface, more functionality. We'll be able to do more with it. We're currently talking with a couple different tech companies who might be partners with us in that space. So instead of developing a whole new app, so to the comment made earlier, there's an app for that. There's so many apps. How do you coordinate all these apps? Instead of developing a new one, being able to supplement, to add on to an existing one. And so we're looking for some partners there. When we go to the production ready version, we will be needing grant funding, and we have an invitation to apply to a national funder, and we'll be looking for other funders as well. So if you're interested very specifically in that communication platform, please do let us know. Once we go to full scale launch and build out statewide, we'll be throwing the doors wide open on that. But right now we are looking for a few agencies to partner with us on that pilot project so that we can refine it so that it meets your needs. We don't want to develop something that we think is great and everybody else is like, yeah, no, thanks. That doesn't really do it for us. So if you want to make sure it meets your needs, please reach out and partner with us. We'd love to be able to work with you. But we're really going to be looking through all of your ideas from this summit, and particularly from the next one, in order to be able to bundle those funding requests into one application. And also keep in mind, if there's something that you're working on that we could support you on, we don't have to be driving the bus on any particular initiative. If you're already driving the bus and you're looking for partners, let us know. We'd love to be able to talk with you about supporting you in your efforts as well. Any questions on any of that? And then I'll kick it over to Todd for his perspective too. Any questions, any input? Okay, well, feel free to reach out to me. Miriam, I see a yes. I'm hoping that was a yes. Awesome, thank you. We'd love to work with you. And if others would like to as well, you can let me know now. And you can also absolutely always reach out to me. I put my email in the chat, and I'd love to continue this dialogue with you. So thank you, Miriam. We'll definitely be in touch, and to any others. Todd, do you want to jump in? Or?
Yeah, absolutely. I think that my head's spinning a little bit from all these conversations. I think it's a lot. I think it's a lot of phenomenal input that we've had. And I think a lot of it points to, I do think that there's ways to do things, improve upon a lot of the processes that are currently out there. And I do think that what we're really trying to do here is bring in those partners and set up a kind of a platform to have these conversations and try to kind of, take this from this to this next step. And so that is, again, kind of taking a big step back of what we're trying to accomplish through this entire technology summit is, today was kind of the, throw everything up onto the wall. And, I think just kind of get all that context out there. But what we are really wanting to do now is take this maybe one step deeper and really hone in maybe on some potential maybe smaller scale, maybe more isolated approaches that we think can really make some impact, and try to bring in a larger group as well. And so that's where a lot of that that May 9th in-person meeting, I do want to make sure we have a chance to kind of introduce that a little bit, is what our hopes are that we've kind of had this conversation with everybody, and that we'll be kind of sharing contact information for everybody in this group. But we also recognize that there's a lot of people that weren't unable to attend this, but we have their contact information now. And so to kind of look at potentially forming small teams that are focused on various initiatives. And so I think it's going to be a little messy, but I think that's okay. I think it's good just in terms of how we kind of ultimately want to have that process play out. But we really do want to have this in-person workshop on May 9th that we can kind of all get together and start, maybe crafting a little bit more of an action plan towards some of these items. Because again, tying in the funding piece, we do think that there's a lot of opportunity both nationally as well as with some of the partners we have in Arizona to actually put some of these items into action. I think we have a kind of a track record of being able to do that with some of our partners here. And so we really feel like the opportunities now that again, these are challenges that aren't going to go away. They're going to continue to grow. And so again, trying to frame how transportation can fit in with this larger conversation around healthcare access and the social determinants of health. I think it's a huge opportunity here. And I think we're starting to get the right players to the table. And so with that, I do want to, and I'm not sure, Andrew, with you sharing your screens, kind of one of the next pieces that we were hoping that we want to do is there's the pre-survey that we issued that we are going to be I'll download that information and send it out to everybody in the group. So you'll at least be able to see who all participated in this conversation. And so this is the post-survey, but the pre-survey, I do want to share that with everybody. So you'll be able to see who's out here and, the answers to some of those questions in terms of where they're coming from, to see if there's, similar initiatives and geographies that you guys could reach out to each other. We want to make sure we're kind of making connections throughout this session. And then this survey that you're seeing here that we'll also add into the chat, and I'll be sending this out in a post email, this is really an important piece to kind of gauge interest in that May 9th in-person workshop. If that's something you're interested in doing, you can see here, there's some questions there. But then I do think that second question is, what are some solutions or ideas that you'd like to kind of bring to the workshop for us to unpack and investigate a little bit further? And with what partners would you like to look at? And so we're kind of intentionally trying to be pretty broad with this, but we do want to you to spend some time on thinking about that so we can really have a very, impactful day there for that in-person session. And then obviously we need your contact information there, because part of what we'll be doing, the kind of planning team here, will be reaching out to you guys individually to try to kind of frame that to help us in planning for that May 9th meeting. So there's a lot to cover there. I will also say that those of you who do receive FTA dollars through ADOT, whether that's the 5310 or the 5311 program, your participation in this in-person meeting could be covered by RTAP, the scholarship, which pays for your travel. And so this is something that the similar process that you've gone through. I'm not sure how many of you will be attending the Arizona Transit Association conference next week, but that same process, you can apply for reimbursement funding for this in-person meeting. And we realize the timing is short, but you will need to submit that scholarship 30 days beforehand. Again, all this information will come in an email, but that's kind of setting the stage there for how we're hoping to build upon the lively conversation we had today. And I guess if there's any questions or any follow-up questions on that. And I guess I would just say that I think that in-person workshop, I think that we have room for, I think we're planning for about 20 to 30 people. And so if there is additional invites of other people on your team or other partners that you'd want to include in that, we absolutely are wanting to have that, those individuals included as well.
And where is it going to be at?
The in-person workshop will be in Phoenix. I'm blanking exactly on the location, but I know that we had
At MAG, so 302 North First Avenue. It's on the corner of First Avenue and Van Buren. We have parking. We'll validate your parking. We'll feed you during the day. So come on out, and if anyone just truly cannot make it, please let us know and we can set up a hybrid option for you. We just really would love to see you there.
Yeah, I would like to add, maybe adding public health as part of people sitting at the table, your local county public health departments.
Hmm.
Yeah, our human services director is connected with the Public Health Association, and I think she's their board chair at this point too. So that'll be a nice connection, so we can follow up with her about that. That's a great idea, Mauricio. Thank you.
Absolutely, and I guess just to piggyback on that, the distribution outlet for this webinar, I think a lot of language we had was, hey, please share this. Anybody that's interested in having this conversation, please share it with that. And I do think to a degree, we'd want to kind of extend that to the in-person workshop. Obviously, we need to coordinate on space capacity to make sure it's not too large. But I do think that I think that we're a little bit kind of relying on this group to help, bring in some of those additional partners that you guys see, and we're hoping to provide an opportunity, an excuse to have this conversation, and we're going to bring in lunch and some technical experts from around the nation on this. And so we're hoping to set that opportunity to really dive into some of these items.
It sounds very promising. I'm super excited.
All right. As a brief informal survey before we close, does anyone want to use the hand raise function to indicate if they plan on going? All right. All right, that's a good start.
And just again, pointing out that real quick, it's a 3-question survey, as we just shared with you. If the sooner that we can have you guys complete that, I do think that we're again going to be presenting the same information at ASTA next week. And so, but I do think shortly after that, we are going to want to be closing that survey and kind of, moving into the prep stage for this. And so, as soon as you can, if you're interested and you think you have some context on that or some visions for some of those items in that survey, please complete it as soon as possible. So.
All right. So with that, thank you all for all of your participation today. This was an excellent kickoff to this effort. So I think Arizona is going to have some great projects coming up in the transportation field in the next few months. So if anyone will include the link to the Miro board in the follow-up email, that'll come from Todd. And so you'll be able to look at all of the notes that we put up there. And that will also have contact information for everyone that spoke today. So you'll be able to reach out to Eric, myself, or our speakers. And if you have any questions or comments about these things, let us know. And what's great about the board is it's a living document. So we encourage more ideas as you stew on what we've talked about so far. Right. And so with that, stop recording.